Good morning. On behalf of the National Mass Violence Center, the National Center for Victims of Crime, with the support of the U.S. Department of Justice, Office of Justice Programs, Office for Victims of Crime, welcome to the 2024 Summit on Mass Violence Victims and Survivors. Whether you're joining us here in Pittsburgh or are one of the 2,300 participants from across the country joining us on our virtual Summit Live event, we thank you for being with us as a part of this first of its kind event. We would also like to acknowledge our ASL interpreters for joining us online. I'm Dr. Kevin O'Brien, and I'll be facilitating today's program. I've been a consultant with the National Mass Violence Center since its inception in 2017. But before we move forward, I'd like to take some time to remember why we are here. So if we could please take a moment or two to silence our cell phones for a moment of silence, as we remember all those who have been injured or killed, all those loved ones and friends and communities grieving their deaths, and those working to support them. Thank you. As a consultant to the National Mass Violence Center, I can tell you firsthand, it's been a privilege for our teams to organize this two-day event. This is the first summit of its magnitude in the United States that is entirely focused on mass violence victims and survivors. As you will see over the next 2 days, we've assembled a preeminent national partners with the goal of launching a national conversation about how to better serve people in communities traumatized by mass violence incidents. While that dialogue is starting here, with your help, it is essential to stimulate and elevate the ongoing national discussion that will continue to develop best practices and resources for survivors and communities. And it's now my honor to introduce Dr. Dean Kilpatrick, the director of the National Mass Violence Center. Many of you personally know or know of Dr. Kilpatrick and his lifelong commitment of service to victims of crime. Dr. Kilpatrick is a distinguished university professor at the Medical University of South Carolina, where the National Mass Violence Center is based in Charleston. That is where he helped establish the state's first rape crisis center in 1974 and the National Crime Victims Research and Treatment Center in 1997. Few people in our field can say that they've dedicated more than 50 years of their lives to research about service and support of victims. Dr. Kilpatrick has done that. Please join me in welcoming Dr. Kilpatrick.
Well, thank you for that very kind introduction. So as director of the National Mass Violence Center, I'm very honored to welcome each of you to the 2024 National Summit on Mass Violent Victims and Survivors. This is a landmark event, and it would not have been possible without the support and guidance of the Office for Victims of Crime, our colleagues at the National Center for Victims of Crime, and our wonderful host at the University of Pittsburgh School of Law. It really was a dream for us to be able to help organize this, but it would not have happened without the help of all of those folks. Profound thanks to each of them and to all of my colleagues at the National Mass Violence Center who worked so hard to make this happen. As we were reminded again this past weekend, mass violence can strike any time, any place, anywhere, and it can affect anyone. This is a particularly harsh reminder for the Pittsburgh community, which is still living with the aftermath of the Pittsburgh synagogue's mass shooting. We at the National Mass Violence Center, like everyone else, wish that mass violence could be prevented. Unfortunately, though, we don't seem to be doing a great job in terms of preventing mass violence. And until we can achieve prevention, new mass violence incidents will happen. New mass violence victims and survivors will need help, and they will need our understanding. Victims and survivors of previous incidents of mass violence still will need our help, because every time a new mass violence incident happens, it sort of pulls the scab off of their wounds. It rubs salt in their wounds. It reminds them of what happens, and it aggravates the problems that they have. And so they will continue to need our help. Communities that still struggle after mass violence incidents, and there are way too many to list here, they will need our help. Mass violence touches the lives of many others, including those of law enforcement, first responders, victim assistance personnel, criminal justice, and healthcare professionals, as well as public health professionals who are at the scene and who work with victims and survivors. They will need our help in two ways. First, they will need help in addressing mass violence-related stress that's vicarious from working with people who've been direct victims of mass violence. And they will also need help and assistance in terms of learning how to better support the victims and survivors that they serve. Anyone involved in planning for or responding to a mass violence incident will need evidence-based information about problems that victims have and the concerns that they have, and how to develop plans that take these problems and concerns into account. That is what this summit is all about, placing mass violence victims and survivors at the center of how we plan and what we do. Why is this important? Mass violence is a major problem for our nation because of the devastating effects it has on victims, survivors, and the communities in which it occurs, and our nation as a whole. Research done by my colleagues and I at the National Mass Violence Center show that victims and survivors have substantially elevated rates of post-traumatic stress disorder, major depression, and alcohol and drug use problems, even years after a mass violence incident occurs. Let me just parenthetically say here that what I'm used to doing is doing 2-hour talks with 150 PowerPoint slides that have a lot of graphs and everything else. I have decided to spare you from that. So this is the, that's right. In conclusion, no. What I'm trying to do is just to summarize some of the major things. Anybody who would like to have a lot more detail later, there is a session in which you can get more than 150 PowerPoint slides. Not really, but I mean, you can get a much more detailed version of this. The other thing that we have found in our research is that communities in which mass violence occurs, people in those communities also have, the whole community has elevated rates of post-traumatic stress disorder, depression, as well as some alcohol and drug use issues. So there's a ripple effect of mass violence that affects not only the direct victims, which we all would, I think, agree that that would be a problem, but it also affects the communities as a whole. Also, many of the direct victims and survivors describe having unmet needs for mental and behavioral health services. So even years after, we find people in communities who are having trouble, they're struggling, but they're still having difficulty, getting the kind of help that they need. One thing that we found as well is that those direct victims and survivors who have good social support are doing better. Those who have experienced previous criminal victimization, including physical and sexual abuse, as well as other kinds of traumatic events, tend to do worse. The same pattern that we found among direct victims and survivors is true in the communities as a whole, including that if you have social support, you do better. If you've had kind of a troubled life before this happens, you do worse. What about the nation as a whole? Well, a national study, we didn't do this. This was actually done by some other people, but it surveyed a large sample, a random sample of adults in America. And almost half, I believe it was 48% of just regular people throughout America said that they were afraid that they or their family would be involved in a mass shooting incident. Almost half. They also said that they did not feel safe to go shopping. They did not feel safe to go places. I mean, again, if you look at the number of places and the types of events in which mass violence incidents have happened, where can you be safe? Where can you be sure you'll be safe? And the fact is that this fear of mass violence is taking a toll on our nation as a whole. Not surprisingly, we found that in the communities that had experienced mass violence, those fears were even higher than they were in the nation as a whole. So again, that's a toll. It's a ripple effect of mass violence that has on the nation, communities, as well as on the direct victims and survivors. On a more hopeful note, it's really important to say that we also found that many direct victims and survivors and members of communities were very resilient and showed amazing strength and dedication after a mass violence incident. It's not a good thing to happen, but we don't want to say that everybody is going to be devastated for life. There is no hope for everybody. There is hope with help and thanks to the strength of human beings. A lot of them can do very, very well after something happens. These are sobering statistics. We clearly have our work cut out for us to meet these needs. And as may be obvious, addressing this problem requires an all-hands-on-deck approach. We intentionally invited attendees to this summit, both here and virtually, who represent a very broad range of expertise in several areas, including victim and survivor services, behavioral and mental health, law enforcement, first responders, emergency planners, prosecutors, hospitals and healthcare systems, public health, mayors and governors, schools, universities, federal agencies, multi-faith institutions, and perhaps most importantly, mass violence victims and survivors. Let me end on a more hopeful note. Each of you at this summit have tools and resources needed to make things better, each of you. And we can accomplish so much and work better outcomes or work towards better outcomes when we collaborate. So thank you for committing to being here, for sharing your knowledge and lessons learned with those around you, and for supporting victims and survivors of mass violence. We look forward to a productive meeting that will catalyze our nation's progress in improving services for victims and survivors of mass violence. Thank you very much.
It is a pleasure to introduce my colleague, Ann Seymour. With a 36-year history of experience as a national advocate for crime victims and survivors, numerous awards and citations, including outstanding service to crime victims from President Bush. and she is currently serving as the National Mass Violence Center's Associate Academic Program Director and has been the backbone in the planning and resources for this summit. Take it away, Ann.
All right, thank you, Dr. Kevin. And can I just say, Dr. Kevin O'Brien is a daily bonus point to our center. He's going to be your co-moderator with me over the next 2 days, and we're so fortunate to have him on our team. So thank you, Kevin. Yeah, you can clap for him. I think it goes without saying, but I'm going to say it anyhow, that at convenings like our summit today, one of the most important sessions is always the survivor panel. Nobody knows the direct and devastating impact of mass violence more than those who have experienced it. You're going to learn today that in a singular moment, their lives were completely changed and their lives' journeys became quite distinct from before the mass violence incident and then after. And you're going to hear a little bit more about that today. The power of the personal story is it's what drives our center. What drives our field. Chris, listening to you earlier, it's obviously what has driven OBC since its inception years ago. I'm going to boil it down to, you can't go wrong with quoting Chris Rose. Everyone here they're here to represent and honor other victims and other communities affected by mass violence. So thank you, Chris. I love when people boil things down to 2 words that I can remember: represent and honor. And thank you for that. Proud to call these 3 folks here not just my friends, but really my inspirations. Each of them has turned pain into purpose. 2 of our panelists are survivors of more recent mass violence incidents that occurred 2 years ago in 2022. And one is a survivor of a mass bombing in 2013. You're going to learn today whether the horrific crime occurred yesterday or over a decade ago, the impact resonates and the impact forever changes one's life. So I would like to introduce our fabulous panel now and remind you, can you please check your, is it Hova app? Hova. Okay. Check your app if you're in the house, because you really respect them by reading their biographies because they're fantastic. And they're also included in the registration information for our many people signed up virtually. So right here is Garnell Whitfield Jr. He is the survivor of the Buffalo mass shooting at Tops Grocery in 2022, where his beloved mother, Ruth E. Whitfield, was senselessly murdered. Another blessing to us, he's been a member of our Survivors and Providers Steering Committee. And I always tease him that we're constantly on the phone about something. And he's a man of great ideas. And we're just so glad to have him here. Amy O'Neill, she was a birthday girl yesterday, so she gave up her birthday for us. I know. She's a survivor of the Boston Marathon bombing in 2013. She has been a member of our Survivors and Providers Steering Committee and a consultant to us and to OBC TTAC. She is a busy woman. Next time you see her at a summit like this, she will be Dr. Amy O'Neill. I know. And John, you seem so far away, but you're close to my heart. He is a survivor of the mass shooting at Club Q in Colorado Springs in 2022. And he is a program and outreach manager at the Prism Community Collective. You have so much to offer today, and I hope you say everything that you said in our pre-meeting, because I was just wowed by what you have to offer us today. So we're going to hope to leave time for questions from the people who are in the house today. We will try to do that. We have Elizabeth is a really reliable timekeeper. So I am going to roll and begin by just hearing a little bit, Garnell, Amy, John, about what happened to each of you, the impact of mass violence on your life. We're going to give a framework for our discussion today. And do you mind starting?
Yeah.
Of course you don't. Okay.
Good morning. As Ann said, my 86-year-old mother was murdered in the top shooting on 5/14/22. She had just left the nursing home, caring for her husband, my father. They would have been married 70 years on the 1st of this month. This was her daily sojourn to care for him. She was his principal caretaker. She did not allow the nursing home to wash his clothing or to do any of those things for him. She insisted on doing it for him herself. She left the store that morning She left the nursing home that morning to stop by the store. I had spent the previous day with my mother, the entire day, building a raised flower garden for her. She could no longer bend over and till the soil. So I thought this was an appropriate Mother's Day gift. It was late, but I thought it was appropriate for her. I had finished it on the 13th, and she was going to go and get seeds on the 14th. She went to the store to do that. Never saw my mother again. I spent my professional career in public safety, responding to incidences of mass violence, of, all kinds of incidences of crises within our community. And so on this day, to be a victim or survivor was particularly difficult for me. I knew all of the responders, all of the officials there, and was able to interact with them in a way that the other families who lost loved ones on that day did not have that kind of access. And so I was able to do that and ascertain that my mother was a victim there. I have a brother and two sisters, I'm sorry. A brother and two sisters. I have 4 children, 9 grandchildren, and 4 great-grandchildren. This has devastated our family. My mother was the glue that held us all together. My mother never would have left here on her own volition. And just to give it some context, I have carried the cross of being Black in America my entire life. Been treated differently, had to deal with, racism overtly and in other ways. And so to have my mother killed by a white supremacist out of hate has been particularly difficult to live with. And that's just the truth. We're 2 years removed from what happened, but I carry the absence of my mother every day. I'm my father's guardian. He turned 90 years old in January. Every day I live with the inadequacy of not being able to care for him in the way that my mother did. Every day I live with the guilt. When my mother would spend a day, I might spend an hour and have to leave. I had to do that to come here. So this has been devastating for my family, my brothers and sisters. We lived vicariously, I guess, to some degree through my mother. There's conversations that we never had because she managed it. And so there's been some difficulties in our relationship since this has happened that I never would have expected. There's just a lot of fallout that we would never have thought would have occurred. And so I just want to lift that up.
Thank you so much, Garnell. Amy.
Thank you, Garnell. And to the center and all the partners for having this forum and having an opportunity to share stories. It's so important for everybody that's doing the work to really understand what it feels like, whether you're bereaved or you've lost something, whatever it is that you've lost in your own personal story. So I was running in the 2013 marathon and was injured at the site of the second explosion. So, I think everybody's probably watched all the clips over all the years, but how do you process what that then does and how you live with it? So I was had some injuries, but was still able to get out of the city by the grace of God somehow, and got all the way home to Pennsylvania, and then went to the emergency room in my state where, they did the medical exam and then planned to have surgery a week later. And the day after, sitting in your kitchen, I send my kids to school, you're just like trying to understand what happened to the world that you knew. You know, and what does this mean? And what am I supposed to do? And where do I go? What do I do today? Do I go to work? I've worked in mental health for over 30 years. You know, can I go to work? Am I capable of working? Will people think that I'm crazy and shouldn't be working? There were so many things, but it's such a lonely space to be in. And because I didn't live in Boston and I wasn't there with everybody to be pulled into what was happening in the community, it was even especially lonely. So because we had a trial and a resilience center, and I was able to participate in that sort of steering committee or advisory committee, you know, I was driving back and forth from Pennsylvania to Boston, you know, every month or a couple of weeks, and having the opportunity to go there, to connect with people, to hear other people's stories, to say, oh my gosh, I'm not the only one that's thinking this or feeling this, was really important, because as Anne said in her introduction, there is a life-changing, you know, moment in time and you can't go back. So, and I think that was one of the most interesting parts for me personally, was sort of running into this wall of like, how do I feel the way I'm used to feeling in my life again? And you trudge through the muck, and that can last, you know, 2 years or 10 years, really, because the impact of that, and, you know, Dr. Dean mentioned the ripple impact, you know, and social support and peer support. And so what does it do to your relationships, and what does it do to your friendships, and what does it do to all the other aspects of your life? So I was very fortunate in that the response effort and authorities and community in Boston, somebody called and said, do you go to counseling? Do you go to therapy? And I'm like, I'm a therapist, never going to therapy. That means something's wrong with me. And then so finally I called, and finally, it was a week later, but it seemed it was a very long week. So finally I called and I said, there's things that have happened in my life that I've never dealt with. Some of my primary relationships, I don't think are in the best place. And, you know, bearing the lead, last week I was in the marathon bombing. So, you know, she called back, and but I think I share that because it's representative of so many things. My primary relationships weren't great. There were other things in my life that had happened, and now this. And then that sort of is, you know, the factor that sort of upsets the rest of it. So, and just one more anecdote on the changing the rhythm of your life. And, you know, I was listening to Dr. Dean share this statistics on what it does to the fear for Americans. I am from outside the city of Philadelphia, and we've waited a long time for our beloved Eagles to win the Super Bowl. And then I had these 2 teenage boys who were like, we're going to the parade. And I'm like, there's a million plus reasons why that's the worst idea. And it's because there's so many people there. So I'm like, okay, who do I know in Philly, law enforcement, who can I call to like give them cell phone? And then I'm like, great, I'll go, we'll all go down together, because that's the kind of thinking that ends up happening. So I know we'll have more time to talk about it, but and I also want to acknowledge that I'm coming from a place of privilege in this. I was a therapist. I understood the system, and I still didn't know. I had access and resources, and I still was overwhelmed. And that really has been part of my motivation post what I've been through, to do my best to contribute to the field, to understand how can we make sure everyone gets what they need.
Thank you, Amy. And last but certainly not least, John.
Thank you, Garnell. Thank you, Amy. So on November 19th, 2022, I went out to Club Q, and boy, did I choose the wrong night to go to Club Q. There was a myriad of things that went wrong that evening that have kind of led me on that path, the path to where I am today. So we can start, you know, with the point of, as a survivor, there's specific moments that are frozen in your mind forever. And I have two specific incidences that night, one of which is looking the shooter in the eyes as he pulled the trigger and said, "Die fags." And then the other one was specifically watching my friend take his last breath right in front of me. You will never understand what it's like to have those moments like frozen in your mind that represent trauma forever. That night, there was a myriad of things in terms of just the response system that also really stuck out from a survivor standpoint that brought me here today. There was a lack of emergency personnel. We didn't have enough ambulances or first responders. So survivors were stepping in and trying to help other survivors. There was people who were put on gurneys and then taken off gurneys and laid on the concrete, and other survivors trying to hold them in place. There were survivors who were put in ambulances with the shooter and brought to the hospital with that person in the ambulance with them. There was somebody who was a survivor who was who was fully stripped of their clothing after being shot in an ambulance, and then somebody more hurt was found, and they pushed them out of the ambulance and made them stand there in the freezing cold and just waited for something to happen. There was absolutely no trauma-informed care that occurred during the response system to Club Q. We were kind of just ushered outside in the freezing cold in the middle of November in Colorado and made to stand there. Couldn't move, couldn't do anything. We were all in trauma. There was no blankets. I think the most care I got that evening was somebody handing me an orange card and said, "For emergency services, call this number tomorrow." And that was the extent of, what we're going to give to you. We saw so many things that happened that evening that went so wrong. And that kind of led me down to this path of just what created ultimately was a systems failure in Colorado Springs emergency response system. How it affected me as a survivor, survivor's guilt is a real thing. There's things that I wish I could go back and change. There's the clock. I wish I could take away the pain that some of the people feel. And ultimately, there was a lack of support from every angle in the response system of Club Q. I still have anxiety walking into places. I need to know where the exits are frequently. I'm constantly hyper vigilant of where I go and what I hear. And, 4th of July just happened, and that's a really rough day, and people don't think about those types of things until you go through something of this magnitude. I think there was a sentiment that resonated amongst a lot of the survivors in the Club Q community, is like we all felt like we were frozen in that moment and we just didn't know how to catch up with the rest of the world. And that was a real thing. There was nobody sitting there trying to assist us in the process of healing or recovery. We didn't have an LGBTQ plus support center. We didn't have people stepping up and communicating or facilitating the needs that we needed to hear adequately. And so ultimately the survivors immediately after we were kind of left, and there was no communication factor. To this day, sitting here today, I still do not know who my victim advocate was for CSPD, for the FBI, nobody. And there is a bunch of us that have no knowledge of who that person was. I was left completely isolated and completely alone to figure it out on my own. And I will speak further on that down the line, but I will say to this, because of that, survivors in Colorado Springs are resilient, and we banded together and we started a system of being able to communicate with each other because other institutions were not doing it for us. And what led me here today was getting involved in that. I really stepped up to the plate, and we needed to ultimately step here today, and that's transitioned me to the Prism Community Collective developer or program manager that I am today, and I'm happy to be here. So
we're so glad you're here, John. I just heard the most amazing thing about you. You carry the absence of your mother's death every day. Amy told us that it's a lonely space to be in, and I hope you're feeling some love from just having the support of people in this room. And John, you and your community, you're like the billboard for the need for improvement. Thank you for sharing the horror of the initial response so so honestly with this because I think Chris, you said earlier let's talk about how we can improve services, and you gave us lots of fodder to think about. So I just want I want to hear from everybody. Chris, I'm quoting you a lot today, so I hope you don't find me annoying. Chris Rose said, "Listen first to victims, not second, not third, not sometimes never." So what's one benefit of listening first? And I'm going to go down this way and then I'm going to come back. One benefit of listening first to victims.
Well, I mean, I think unless you hear it from someone who's experienced mass violence, you will never be able to understand what their needs are.
Yeah.
So I think they're best positioned to convey what it is they've gone through and what, what they think they need in this moment in time.
Yeah. When other people say, "I know how you feel," they absolutely
No.
do not know how you feel.
Absolutely not.
Thank you, Amy.
Yeah, I think this is a great question. I've thought about it a lot. And I think, in addition to what Garnell already said, it's a real bi-directional benefit. It's really good for the victims
Right.
because it's helpful to tell your story, to get that recognition of your experience. And I think it's good for the providers to really hear what people need. And my friend Josh Garcia he's from the Pulse community, said at a conference to listen for the whispers. So, the little things that people say or don't say, or we're always looking for that, for you to get to know something, to have that validation, that sort of interactive. So the listening.
Pretty important. John.
Yeah, I would echo exactly what you both said. Survivors' voices provide us with direct feedback, enabling us to implement the necessary changes. And listening to that feedback over time helps us with the intermediate, the immediate, the short term, and the long term needs of survivors. In the case of Club Q, there was an institutional distrust between LGBTQ plus community and these institutions that responded. And so because of that mistrust, it really made it culturally difficult for these individuals to get the resources that they needed, and for those institutions in return to serve them. They didn't know how to serve them. So being culturally aware is very important.
And let me put this in reverse. And John, we'll start with you. What happens when you don't listen to victims, when you don't engage them? What's one possible outcome there?
Sure. So when you don't listen to victims, you're creating a lack of a trauma-informed environment, and you're not catering to cultural insensitivities. Again, to bring it back to, Colorado Springs, we had an expo center that was put in place for survivors immediately after the Club Q response. There was an improper setup. CSPD put it together. They were not supposed to. It was supposed to be El Paso County Emergency Management, which failed to do so. The timing of it, we expected survivors to go to a resource expo center the week of without any knowledge of it. It was not communicated to them. These are people who had experienced the worst moments of their life and needed help getting there, and that was not offered to them. So that was an unrealistic expectation. And then it was an overwhelming, untrauma-informed experience. You walk in, there's a gentleman greeting you with a gun right there. You are bombarded with people coming to the door. And then, you are seeing organizations who have primarily said, we do not support LGBTQ plus individuals in that building. So it was a very poorly thought out thing.
Thank you. Amy?
Yeah, I think you really risk the further traumatization. That lack of the acknowledgement or recognition, you're not seen in the response effort because it's very unique and there's such a wide variety of needs. So you really need to know what, individual, if you're bereaved, if you're injured, everybody just has a different need. So you really need that collective understanding of that individual and unique community. And I think, if I go back to it's so hard to try to describe what that loneliness is, but if you're dismissed or if somebody doesn't get what your need is, then you do continue to swirl around in that space, feeling lonely, feeling like you're not getting what you need to get better. And I also am listening to both of you, and I keep thinking about building that trust I think if you don't listen to the survivors in your specific community, how can that community trust you? Because you're coming forward without knowing
Mm.
what the culture in that community is. And I think that's an important benefit too, because from a victim perspective, you are you have power. You're the institution. And if you deny my experience, you deny my existence, you know, and I stay really stuck in a space.
Darnell, bring it home. If you
Yeah,
don't
well,
listen to
I agree with
victims.
everything they said. Everything they said. I would point out that when we talk about you know, exacerbating or you know, compounding that trauma, oftentimes in marginalized communities, they don't have a voice and they're not included in many of the things that go on in that community generationally, way before this incident. And so for them to have that experience during this traumatic event again is again re-traumatizing and just exacerbating pre-existing trauma
Yeah.
in those communities.
So you're talking about layers of trauma. And I
Yeah.
think that is such an important message for everyone here today. So we talk about meaningfully engaging victims and survivors across the spectrum of especially recovery and resiliency efforts. What does that look like? What are some examples? Just if I can get an example from each of you, how do we engage victims and not just talk about engaging victims? Amy, I'm going to start with you.
Sure. I mean, I think this summit is a great example. So
Voila.
organically in the lobby
Yep.
last night and at dinner, lots of people gathered that have been directly impacted and shared stories, experiences, camaraderie, tips, benefits, resources. And it was like this mini conference all of its own. So I think that that's really helpful. Needs assessments, opportunities to come together. Not everybody gets a trial, but I think those experiences too, anytime you have an opportunity to gather with other victims as well. But the needs assessments for sure, and the wide scope of the need assessment.
And you and I have talked before. How do you find out what a victim needs? You ask.
Yeah.
You do an assessment. It's so simple. It's
Right.
amazing.
And just so many people hide. They feel like if I didn't lose the ultimate, if I didn't pay the ultimate price, am I allowed to need what I need? So
Yeah.
if you don't come to us and ask,
Yeah.
you're not going to know.
All right, John, one example.
Yeah, so I would say really getting your local municipalities involved and institutions involved in the response efforts. We did so, and after the response was all solidified, OVC came in and did a debrief with these institutional leaders. We took it a step further after that and re-adjourned these 26 systems leaders, you know, with CSPD, COVA, CSFD, City of Colorado Springs, El Paso County Emergency Management. And we took victims and survivors and we had a fishbowl debrief, and we spent 2 days on this. The first day was survivors sitting there and actively listening to what they did, or telling these responders what they did wrong in their response and how impactful it was. There was not a dry eye in that meeting that day. And the ultimate outcome of that was the next day we came together and we really debriefed what they had heard, what the experiences was from the victim's standpoint. And it caused us to all agree that we need to really change the El Paso County Emergency Response Plan. So we are now adjourning monthly to rewrite that entire system plan in place, and also making sure that we are culturally aware of how to address marginalized communities.
Yeah, John this morning gave me the bumper sticker for the summit. We're here to change the system.
Mhm.
Amen.
Systems change.
Amen. Garnell, your system changing. What's your answer here, brother?
Well, I think that if you're going to engage with the victims, you have to empower them. I mean, a lot of times you use the tools of whether they're the assessments or whatever it is. We have those tools that come in. They're not always adhered to. They're not really always incorporated into the response plan. It's sometimes, in some cases, just checking a box saying that I went through the protocol, I did this, this, and this, but they're really not included in the decision making. And I think unless they're included in the decisions that are made that come out of those assessments and that, then that's not real engagement. So I think we have to be sincere. We have to be honest about what our purpose is. Are we there to empower them and to help them stand on their own? Or are we there just to, to hold them up for a moment and then disappear?
Yeah, don't check the
Yeah,
box.
right,
That's stupid.
right.
Okay, thank you so much. I'm going to do an informal poll. How many people in the house here have heard the term victim-centered? Raise your hand. Trauma-informed, raise your hand. We're going to unpack it right here in terms of the experiences of the folks on this panel. I'm going to ask John, we're going to start with you and then Garnell. What do victim-centered services look like? Let's get beyond the terminology.
So for us, victim-centered services, it's really providing essential support and resources by actively listening to the feedback of survivors and victims' families. In short, it's taking that information and really actively listening to what the needs are. PRISM was founded solely on us adjourning victims and survivors' families in meetings every week for months, 18 months in the making, and even doing a retreat. And everything that PRISM is developed solely on what the survivors and victims told us that they needed and the community needed. So listening to that feedback and making it happen. And then, knowing that what we have now is going to evolve over time, that as the years move on and survivors' needs change, we are going to have to evolve and change with that by listening. And so we have a PRISM Advisory Council, again, composed of survivors and victims who are continuously telling us what we need to do, how we need to actively run the center, and what the needs are that we need to serve.
I'm guessing, knowing your community, your advisory council, people actually listen to what they're saying. And the same with our survivors and providers committee. We take it so seriously. Thank you. Those are great ideas. Garnell.
Yeah, again, agreeing with John, putting the victims and survivors' needs, making them your priority, making sure that they're culturally, appropriate, gender specific, ethnically, age appropriate responses, being flexible, being willing to tailor your response to that community, to the needs of those individuals within that community, and understanding that everybody's different. So even within families, there's nuances within the family itself. Dynamic that you might have to tailor your response to, and being sensitive to that and open to that, I think is victim-centered services in my mind.
Again, I'm sensing that everyone here and the thousands of people that are tuning in virtually, we all have a little experience in active listening. So put it to use. My mantra in life is be fluid and flexible. It's so important that we be able to adapt to those who are serving. So thank you for that. And Amy, in a nutshell, trauma-informed services and support, what's that look like?
Yeah, so I think in a case of an MVI, trauma-informed care and support services means that you treat each event like it's its own individual. This is the first time anybody's experiencing that in that moment. So I think taking that knowledge into everything that you do, into every interaction is essential, I think. And that also means there's no hierarchy in suffering. So every single individual experience, you don't know who that person is and what they're bringing with them. So even though some people may lose differently, try not to, put that into a hierarchical. Transparency, I think, is essential. And it could be anything from, the way that the funds are being dished out, you're not getting any. And this is why. To instead of not communicating with people or having them understand what I think transparency and that goes in the whole system and how everybody coordinates working together, down to the written communication, the compensation program, replacing words like your claim is denied and you are ineligible, because when you think about that victim experience, to read that letters in that abrupt way is, and I will say proudly, I think this system has really been working on that. I know the VOCA Center's done a lot of work on the written communication part. So, and then everybody coming together and just working together, different kinds of expertise and using each other's expertise to benefit the entire community that's impacted.
I want to really support the Kumbaya theme. We've never had this group under one roof before. We need to take advantage of our 2 days together physically, because we represent everyone who is needed for mass violence, readiness, response, recovery, and resiliency. So
And outreach
and outreach.
for trauma-informed care, because not everybody comes to the door for lots of different reasons. You have to come and find us and tell us it's okay to come to the door.
Yeah, if you build it, they don't always come. We know
Right.
that in our field. So I'm going to ask John and Garnell, this is so important to all of us. Your mass violence crime occurred in communities that are considered marginalized or traditionally underserved, an African-American community, that LGBTQI community in Colorado Springs. Can you just tell us what are some of the challenges that this creates for victims and survivors, and what are challenges in accessing culturally appropriate services? Who wants to go first? You're looking at me like you do. All right,
Well-
Garnell.
Well, for one thing, culturally appropriate services in our community didn't exist. Or they were very few and far between. And so, in our community in Buffalo, I think what you have to understand and take into account is that the infrastructure that would allow you to respond to something like this was not in place. The relationships were not in place. There were people who were doing work in silos on the ground, but there was no leadership. There was no cohesive leadership that would have allowed, an appropriate and a holistic response to what happened in Buffalo. And so I think that's our major issue. And we continue 2 years later to try to build that infrastructure. So that's the journey we're on. I hear a lot about, and I Beverly's here from our Resiliency Center, and thank you for being here. So that's great that she is here. But this is a work in progress for us. So in marginalized and under-resourced, underserved communities, there's no way to receive the many resources and things that would come in. And oftentimes when they do come in, they're not appropriately staged or not appropriately directed because the requisite expertise and sometimes even the will to do that is not there locally. So I think that's the challenge in communities like mine.
I just want to say, I hope we all agree that we're beyond the point where a community says this is never going to happen in my community. Do we all kind of feel that way? And what Garnell is saying, the infrastructure not in place, relationships not in place. The message is they need to be in place. And that's part of why I'm so glad we're here together, and everyone who's tuning in from around the world. That's a challenge. Get your ducks in order. Garnell tells you need to have those things in place. I appreciate that. John, thoughts?
Yeah. Echoing what Garnell said in terms of, our response as institutions and government organizations, we do not have the ability to choose who we are serving. In our fishbowl debrief and our OVC debrief, it came out that nobody wanted to put their name on helping these survivors of Club Q because it was an LGBTQ plus organization in a very conservative city. And so nobody wanted an affiliation or an association with that. And because of that, we were not able to get the resources needed. We have survivors that are still struggling today because they were not catered to or given the items that should have been given to them. And so just to put in perspective of that, remember who you're serving. It's not just survivors, but you are serving culturally sensitive individuals as well.
Right.
And a community that was targeted. I just want to, you and I have talked about that, and you and I have talked about that. Do you want to add to that at all?
No, I think John sums it up. I think that being culturally sensitive and being respectful of the differences between us is very important. And I think that goes a long way in terms of building bridges and building trust within that community, which will allow you to serve them better.
And get your infrastructure in place and get your relationships in place, right, Garnell?
Before something happens.
Before it happens. All right. Finally, because I'm hoping someone can tell me if we have time for Q&A, because I hope we do. Each of you, in ways small and large, have become advocates, and I hope it's okay to say activists for positive change in how our entire nation, but also individual communities prepare for mass violence to improve their response to mass violence. So what's your most positive, let's go on a positive note. What's your most positive message to everyone here and tuning in from around the world on how we can improve our individual, but also our together responses to mass violence? John, can I start with you?
Sure. So I'd say as institutions that serve mass violence tragedies, survivors and victims' families, Uplifting survivor voice is critical to gaining the feedback on the support and needs they require. As institutions, we should start becoming more comfortable with sitting in that discomfort, because that is where the biggest growth happens. It is in the space, or I'm sorry, our role is to help those who have gone through the worst moments of their lives, and we need to actively engage, listen, and consistently ask ourselves or ask them, what do you need? Even leaders of nonprofit and government organizations must be willing to set aside their own institutional beliefs and accept both the negative and positive feedback that mass violence victims bring to the table. And again, for those serving marginalized communities, and that's everybody, because you may not be a center that serves a specific organization, there's still people within that realm. You have a responsibility to ensure we remain culturally responsive to the needs of those communities.
Thank you. Amy.
I'm going to say communication and messaging. So that was brought up a little bit this morning, whether it's positive messages through the media, transparent communication. I think the more psychoeducation, the more you learn and know as experts and learn from victims and survivors and communities, and then share that information back through social media channels, through the websites. I think there's an opportunity for people to start hearing it's okay for me to come forward. I'm that person that speaks to me. And I think some of it is that public health approach and model, and sort of knowing stage of change, like where people are in the process, and making the messages specific to speak to where people are in the journey. And just even the repeated message that it's always okay to come forward at any time, because you never know what is sort of the event that topples all that we carry.
You never know. That's right. Garnell.
Yeah, take a page from Mayor Gainey and say that love. We have to learn how to love each other, how to love one another. We talk about differences, cultural sensitivity. We got all of these terms, but it really boils down to, do we love each other as human beings? Why are we doing this work? You know, what are we here for? Are we here to empower and to lift people up and to build them up? Or are we part of that burgeoning cottage industry that has monetized our trauma and, making a lot of money and not making a lot of difference in the lives of those they're called to serve? So I think that we have to make sure that we're in this for the right reason, and be committed to that, learn how to love each other. And we talk about marginalized communities. That's a term that we're accepting of. Why are they marginalized in the first place? We have to talk about that. And we have to be willing to change the things that cause them to be marginalized in the first place, which means we have to be able to look at our systems, our policies, and people, and be willing to root out those things that are part of that marginalization. And we have to be honest about that. And that's what I would.
That's what he would do. I want to say thank you for saying it's important to be comfortable with discomfort, because most people aren't. And that's why they sometimes fear victims and survivors, because I know it's going to make me uncomfortable. John, bless you for saying that. Amy, transparent communications, we need 8 hours just to talk about that. But really think about our messaging and our language. And something you said that's really important is that it can come at any time. And you were 11 years ago, you both were 2 years ago. It's not something that goes away. I appreciate that. And of course, Garnell's going to make me cry by saying all we need is love, which is really important, but also dig a little deeper and ask the question, why are communities marginalized? I think our Mayor Gainey today gave us a little taste of the answer to that. I think framing this, Dr. Dean has always said, this is a public health issue. So I just think that's amazing. And I do not know if we have time for questions.
Yes, got a couple,
We do? What's a couple, Elizabeth?
like 2.
Okay, we have time for one awesome question. So I probably should put my glasses on so I can do a rando choice. Is there a really good question, a burning question from the audience? Is there, I got to put my hand and see a hand up. Is there anyone? Alberto Ruiz from El Paso.
My question would be for John. Since you mentioned that, and I think it's really great that your agency outlets the voices of the victims, which I think it's a must. but by 10 years of experience, I learned that we need to do that really discreetly, because the last thing we want is for a victim to be told they're being heard and then not see any action. afterwards. What is your approach to preventing that from happening? I always tell my team, listen carefully, we'll analyze discreetly, and we'll address the need in a way that doesn't seem too obvious. And to get it.
Yeah.
If listen to this person, but how do you approach that?
And so can I summarize for everyone who's tuning in? What are the actions that have to follow listening?
Yeah, I would say after a survivor comes to you and says what they need, you actively do everything you can in your power to deliver what you can. You jump the hurdles, so to speak. As somebody who was serving survivors, I literally would jump through hoops to make things happen specifically for those survivors. At prison, we have community resource specialists who are hired on specifically to serve those needs and make sure that they are brought through that process. And additionally, if it's a big ask, we have a prison advisory council that we can lean on of other survivors to adjourn and talk about. So we're able to, have a good conversation and have a group discussion, and that person can come into the table, present an offer of what they need, and then we can talk about it in a group setting, and maybe they'll have a different perspective by the end of it, but we always try to deliver that resource.
Are these people amazing? And please give it up for our panel. I also want to say, I'm going back to listen first, and this is why. So thank you all so much. Thank you, amazing panel. Dr. Kevin, back to you.
Thank you, Ann.
You are welcome, Kevin.
Thank you. As Chris said earlier, everybody's supporting Chris. The families and survivors are leading the way. I would just like to say on behalf of all of us, our work will be better, and we are better people for the stories you shared and your courage in being with us today. And it's a tribute to all those who have died. Our next panel on lessons learned will be facilitated by Dr. Alyssa Reingold, who is the director of the National Mass Violence Center's Response, Recovery, and Resilience Division. She is both a clinician and a researcher, and was instrumental in the response and recovery efforts in Charleston, South Carolina, as the director of the Resiliency Center established following the Mother Emanuel mass violence incident. She has also recently published a paper on a national survey in bereavement. Alyssa.
Thank you. Well, good morning, everybody here in person and those virtual. And I've got a little bit of lofty goals here, I realized as I was reviewing our questions for our panelists. So hopefully we'll kind of maybe hit some high points when it comes to lessons learned related to best practices for preparedness, response, and recovery efforts after mass violence. And so I've got three wonderful panelists here. I'll do brief introductions. I've got Dr. Stacy Beers, who's the Victim Services Coordinator for the FBI Victim Services Division. She's also a crisis response canine handler for the FBI, and hopefully y'all can meet Wally, who is here as well with Stacy. And Wally is one of the first two FBI crisis response canines designated to work with victims and first responders at crisis incidents. Dr. Beers launched the FBI's death notification training, we regret to inform you, in 2015, and recently excited that in 2024, the course has expanded into FBI's trauma notification training. One of the goals of this training is to ensure that offices have specially designed teams to assist with death and other traumatic event notifications after crisis and mass violence incidents. We also have joining us on our panel is Maggie Feinstein, who's the Executive Director of the 1027 Healing Partnership. Maggie is a master's level professional counselor who has distinguished herself in the field of integrated mental health. And I'm going to also add in here and in mass violence behavioral health. She received her undergraduate degree at the University of Wisconsin-Madison in international relations and received her master's at the University of San Francisco in counseling psychology. We have Pamela Ferguson Bray here to my right, and Pam has served as the Executive Director for Hawaii's Crime Victims Compensation Commission since 1999. Ms. Ferguson Bray served as the Executive Director of the Commission on the Status of Women as a Deputy Prosecuting Attorney for the City and County of Honolulu. She received several awards. She's received the 1994 Hawaii Women Lawyer of the Year Award, the Crime Victims Financial Restoration Award by the United States Attorney General, and the Loretta Delana Fuddy Lifetime Achievement Award from the Institute on Violence, Abuse, and Trauma. So thank you all for being here today as we talk about lessons learned. And I'm first going to open it up. And I know that preparation for mass violence, victim support takes intentional planning with a wide breadth of partners. And so I'm going to first start off with Pam. Based on your role as the State of Hawaii's Executive Director of Crime Victims Compensation Commission, who do you think are essential partners that should be part of mass violence planning? Let's first talk on the state level.
Well, because Hawaii only really has 4 counties, so our sort of state and counties sort of merged in a way. So really looking at trying to make the not linear path of planning a little more linear, and who should be involved. The groups that really umbrellaed the organizations that we brought together to do planning, mass violence planning, were kind of umbreled in a way by the help that we've gotten over the years since the beginning of our efforts from OVC's TTAC folks, and also from the National Mass Violence Resource Center, who've been involved with us since 2017. Dean and Kevin, all participated in our early trainings in 2017, 2018, when we brought our community together. And OVC TTAC has worked with us, identified emergency planning, reviewed our state emergency plans, recommended different language for what should be included in our state's emergency plan. So the folks that we brought together were really umbrellaed by sort of some vision and guidance from our national partners. So we had a very robust in Hawaii, very robust victim service group. So we recommend that you solidify that group before you invite other people in, so that we're not confused about what our role is together. So we're fortunate we've been meeting, for decades every quarter with all our county victim assistance program leaders, FBI victim assistance, U.S. Attorney's Office, Homeland Security's now joined that tight pool of people. So when we began looking at planning, we invited everybody that we could think of that might be involved in planning and responding to mass violence in our community. And because Hawaii is very unique, we have a very robust tourist industry. So we have people coming in from across the world, millions of people literally every year. So we made sure to invite those folks. Also our language access office. So, all the usual people that you would think of, emergency management, law enforcement, in addition to that very unique group of people. At one point in time, we realized that inviting people who might not end up being the leaders in their organizations was a mistake. And so what we did is we had our lieutenant governor write a letter. We organized a conference. We had OVC talking about why we deserve as a victim program, where we stand in response, because people weren't really clear about who we were. And one of the things that the Lieutenant Governor's office letter said to the folks was, if you choose to send a representative, send somebody who will continue to represent your organization and participate in future mass violence response planning meetings, who has authority and who will be responsible for making decisions and who can commit your agency. So we wasted a lot of energy bringing people together. We'd have people coming from agencies, send whoever it is, today who's not busy. But it was really important to short circuit that problem by creating a very specific forum whose mission it was to identify and buy in the people who would do the planning with us subsequently.
Thank you. So it sounds like making sure to have the actual decision makers at the table.
Yes.
And being more inclusive, not just your emergency managers, but making sure you're inclusive of victim service agencies. Crime Victims Comp needs to be at the table, your other community partners in addition.
And also I think that it was important for us to take the lead. That we took the lead, created a mass violence planning work group to bring people together. So taking the lead and just starting, because there's so much to do and it's so daunting. I think one of our messages always is you just have to start, and there's plenty of people who can help you.
I'm going to ask just a follow-up question, Pam. Any unexpected challenges that you faced in developing preparedness plans, to ensure that they're victim-centric?
Well, we did the original conferences to just so we could meet the people in 2017. Like I said, we started. And so what we've discovered is that people didn't know who we were. And I'm sure many of you in the field get these questions. We had no idea there were victim services providers in the prosecutor's office that were knowledgeable and experienced in helping violent victims through the system and in recovery. We had no idea there was a compensation program that could provide these types of services. So that was a significant barrier, because why should they include you in emergency planning if they have no idea who you are and even what role you play? Also, the all hazards nature of emergency management response suggests that everything is the same. There's a hurricane, there's a volcano, there's a fire. The response from the behavioral health response and other responses are the same. And so a lot of our focus when we had Dr. Reingold and Kevin folks come out to do behavioral health training was also about, for the people in attendance, is making sure that they understood why it is that they need this community, people with this information, to be responding immediately and to be part of their planning. So that was really, really important. And then we also identified that, limitations we had. We didn't have the training and skills in our community to have the behavioral skills response. And so in 2023 and 2024, we were really fortunate that Dr. Reingold and Kevin came out to do behavioral health training. This last training, we really focused on one of our other areas that we were missing, which was cultural response and, making sure that we had language access, really making sure that everybody who needed access to our program, that we looked at providing our services in a way that was responsive to their experience of trauma, their experience of grief, that might look different, that might call upon us to look at the behavioral health tools, psychological first aid and stuff in a different way as we interact with those populations.
Thank you. And I appreciate your state sort of taking the lead in continuing to not only just create your plan, but continuing to engage in training and identify where the areas of gaps are before an event occurs. I think it's really essential. Thank you. I'm going to go down to Stacy now, thinking about talking a little bit about preparedness. In your experience with mass violence response, what observations do you have related to communities that have preparedness plans in place for mass violence and those that do not, or any other recommendations you may have around that?
So I think that the survivor panel really showcased what it was like and what your experiences were like when you don't have a victim-centered, culturally inclusive lens in your approach. And so I can't say it any better than they said it this morning. You really have to know your community. You have to know your community before you launch. And so for those of us who are helping with our planning and preparation, as well as our deployments, it really is incumbent upon us to understand the community and really embed with the community and realize who the stakeholders are. So I think the key takeaway is that the communities that have plans really are inclusive of different stakeholders. They're vetted in advance, and they certainly know the responders in advance, and we're just not meeting on the fly. So that's what I would say is a takeaway, is definitely know your community and make sure that you have those vetted agencies at the table as far as including planning. And one of the things that OVC has through MUSC and the National Mass Violence Resource Center is that the toolkit, and really focusing on the toolkit and looking at the resources that are there to kind of help you build those plans in advance.
Thank you. So not only I hear just not having a plan, but not only knowing who your community is, all the different pockets of your community that might be impacted, but also knowing who are all the professional players.
Yes.
You don't want to be going on the scene and introducing yourself to the other partnering agencies for the first time.
Right. And know the underserved populations, right? Because they're going to need the resources a lot. They probably need the resources before we got there, right? So making sure that we know who those groups are so that we're prepared to serve them in the best way we can.
Thank you. And then if an event were to occur in a community, typically, after the first 24, 72 hours, a family assistance center might be established to provide support, more immediate support to families, survivors, and the community members. I know this question you could probably spend an entire afternoon or day talking about, but can you just provide for folks that may not quite understand what a family assistance center is, kind of what the current best practice, what it is, and what kind of, just hit the high points of some current best practices if you can.
Sure. So as you said, the Family Assistance Center is usually set up right after the Friends and Relatives Center within 24 hours. It's sandwiched between the Friends and Relatives Center and the Resiliency Center. So that's kind of like the middle piece of it. As I said, it's set up within 24 hours. It's usually set up by somebody who's a leader in the community. It could be also Red Cross, or emergency management. It really all depends who has the plan for it. It usually is open for 10 to 14 days on average. Sometimes it's shorter, sometimes it may be longer, but it's a space, it's a safe space, it's a secure space. It's a venue for really authorities and agencies to provide resources and information. Some of the key points of a family assistance center is it has to be accessible. People have to know how to get there. It has to be accessible by public transportation. There should be some security around it, not having, as I heard the survivors panel, I always say this when we teach, we have law enforcement there in the aftermath of an active shooter incident. And what's the first thing that people see? People with weapons on, right? But, so we have those conversations about how to mitigate those concerns. But we want to make sure that it's a safe place for folks to come. It's not open to the media. It may be open to the media at the beginning, just without victims there, of course, just so that they can kind of let the community know what is there. We need to make sure that there are people there that can help communicate with the community, whether it's interpreters, whether it's people who are that really make up the demographics of the community, your vetted agencies. Some of the agencies include with resources, as I said, Red Cross. Also, crime victims compensation is really key to have there. Mental health or behavioral health there. The medical examiner or coroner, because people have a lot of questions about death certificates and next steps. We also have sometimes the Department of Motor Vehicles, because when people flee scenes and that sort of thing, they leave their wallets, their purses, all that kind of stuff. So they're missing ID. Legal representation. Sometimes there are times where people, there's childcare issues, there's child custody issues, there's state matters. There could be legal matters that were going on in the family. And now that person is no longer here, they're deceased, it brings up all kind of legal issues. Obviously consulates, if we have foreign nationals that are part of family, the community, we need to have consulates there. Law enforcement, because sometimes we're doing interviews. I'd be remiss if I didn't say that we need to have facility dogs there because they make everything a little bit better. Even if we can put a smile on a survivor's face, in all honesty, even if it's for 10 seconds, it might be the only 10 seconds in several days that they've had a moment. And then we also want to have folks that are vetted that do the companioning process. So generally what happens is, you have a companion that will meet a family at the very beginning at the desk where we check people in, and we will do an assessment with them. What kind of needs are they here for? What kind of services? It can be very overwhelming for families and victims. So maybe they can come for the first day and we only see 2 resources, but then they come the next day and we see 2 other resources. So really meeting people where they are, and the companions definitely walk people through that process. And so they're able to do that. So that is a very high level overview of a family assistance center and kind of what you can expect.
Thank you. Any resources for folks that want to learn more?
Oh, yes, you can certainly, yes. So, of course, so you can go on the toolkit as well. And I will say that we are currently updating a guide that we developed in coordination with the National Transportation Safety Board with them in 2015. So we're actually updating that guide because what we're hearing is that's a guide that people really look for. The other thing, and not to put panic in anybody's world, but just so that you will know, when we're thinking about a mass violence incident, and people ask like, what kind of venue should we have this in? What does it look like? How many people should we plan for? The average number of individuals that will show up per victim is 7. So if you have 10 deceased, you're already looking for space for 70. And I'm looking at Kathy in the audience because the Family Assistance Center that we set up in collaboration with the city of Orlando was incredible. It really was something that I reflect back a lot. And there were 49 deceased. So can you imagine the number? We had to have the Camping World Stadium. We never have used a venue like that, but it was incredible. And the city really turned it on for the victims. So those are the numbers that you're looking at to plan. Thank you.
And just to highlight, when you said the toolkit, so the Office of Victims of Crime does have a mass violence toolkit that's available online. And specifically in that toolkit, the FBI and National Transportation Safety Board has a specific document that talks about how to establish a family assistance center. So folks that want to gather that additional information, thank you. And Stacy, can you describe, I mentioned in your introduction very briefly about the trauma notification training and its shift from your prior death notification. Can you speak a little bit about this new training tool?
Sure. So in April of this year, we were very fortunate to launch the trauma notification training. It was fully funded by the Office for Victims of Crime. So thank you, OVC. It really has moved into the FBI.gov realm. You can find it on FBI.gov/trauma notification. It's about an hour training, and we've actually changed it from a death notification lens to trauma notification, because what we have found when we're dealing with mass violence incidents is we're just not dealing with death. We're dealing with people who've been traumatized, injured. They've seen something, they've heard something. And so we've really opened up the aperture to really focus on trauma notification. The other thing that we've done is we're looking at it through a culturally comprehensive lens. And so the training really incorporates videos of when things don't go so well, and then when they do go well. So there's little 8 video vignettes in there. Again, we're looking through it. We're going through it in a different kind of lens. So there's videos on challenges, lessons learned. There's also a mobile application that you can download. So anybody, if I had the QR codes up here, you could take a picture, but you can go on wherever you get your apps and just type in trauma notification and download it on your phone. So the app is partnered with the trauma notification training, and it actually goes through the training. It has a lookup feature. So if we're launching in a community and we don't know where the hospitals are, we don't know where the medical examiner or coroner is, law enforcement agencies, you can put that in there, and it's definitely a search capability. The other thing that the app brings is before we leave a home or before we leave a location with a victim family, we like to give them information about grief. And so there's a generic coping with grief brochure. We've been able to translate it into 11 different languages. And through the app, we can push that out to families, either via text or an email. So we're really excited about launching it, and I'm very happy to have it out there and live. So thank you.
Thank you. And if you'd like to learn more, I'm going to do a little plug that we did recently, I believe, dropped a podcast on our podcast series at the National Mass Violence Center, where we interviewed Stacy a little bit more about that trauma notification. So please check out our podcast. So thank you. Now I'm going to shift a little bit to Maggie. And I know you've served as the Resiliency Center Director for 1021 Healing Partnership since its development in 2018 in the aftermath of the Pittsburgh synagogue shootings. From your perspective, what are common misconceptions or unexpected challenges that communities may have when kind of considering that long-term recovery efforts for mass violence?
I think one of the things that I wish someone had said to me early on was just how normal conflict is in this process. It feels really bad because the challenge of being part of a community, right? And there's this sense that we should all be in this together. And I think that actually earlier, Al spoke to it very well, but that there's so many reasons why conflict can occur that has nothing to do with the actual event, but is something that comes up afterwards. And that it's normal and healthy was something that I think was unexpected, and is actually something that I think it's a disservice to a community to think that it wouldn't happen. So, I mean, I think that the way that we've come to talk about it a little bit in our center is just that the challenge is that there's this hero moment that the media really cover after there's a mass violence incident. That's a very public incident. The victims and the families and everybody are very publicly known. And this hero moment then goes to either them continuing that narrative or switching it over to conflict. And then they highlight all the conflict. And that the truth is that the best way to kind of handle it, we've learned, is that if we cannot flatten the narrative, if we don't make the story so simple, then you can hear the nuance that conflict is normal, conflict happens, and beautiful heroic moments happen, and that we all heal in different ways, and that there's sort of there's an endless and that can be added in there as long as people are looking for it. And so the misconception was that this is all going to be harmonious. I think, for all the Resiliency Center directors, I've said this, I thought that people were going to say, thank you for taking this job. That was a misconception. That was not exactly what you experience. You experience instead people just looking at you with wonder. What is going to happen here? And I think a lot of it has to do with our misconceptions of trauma, which is that, do you have a magic wand to make this feel all better? If not, then you're doing nothing. And that there's just kind of this challenge and that conflict of riding through the conflict, being part of it, sitting in it, and not trying to run away from it. And I really think John highlighted that a lot in what he said earlier today. I have nothing sort of more profound to say to it, but it is part of the work is to be in that conflict. And that was not something that I necessarily knew or expected. And I think, specifically the only other thing that I would say was really practically speaking that the trials, what to do with the site of the tragedy, how to create a sense of identity. All of these are the things that practically speaking resiliency centers are put in place to sort of be there through with the community, to walk alongside. And I think that at first, the kind of perception of isn't that really sad or hard, but that also bringing out, we talked a lot about vicarious resilience. We talk a lot about the way that communities grow together and that you don't have to have had the immediate experience to learn from it. And that is something that, nobody sort of told us to embrace, but if we can embrace that, it allows sort of a growth of what is going on in areas that people may not see.
Thank you. And I know, so it sounds like kind of just expecting the fact that it's not a linear road, and that there is a lot of challenges kind of even before an event occurs in a community that can also impact in the aftermath. And that, as a resiliency director, kind of sitting in that is really important. I know you and I've had many conversations over the years around that and kind of validating. I remember you were like, what, are we doing something wrong here? No, unfortunately, like that's trauma, and that's communities impacted by trauma. And how can we sit in that ministry of presence to help kind of foster some of that support? So thank you.
Absolutely.
What would you say are some strategies from your perspective that can help communities sort of build that long-term recovery?
Yeah, I mean, I think that, again, that listening to victims, you've heard that this morning, it is absolutely important. I loved what Amy said, and I know, Amy, you were quoting somebody else about listening to the whispers. The strategies of really figuring out a way to build trust, to build community. There's no way to highlight the vicarious resilience if you don't know how people are getting through this. You have to be able to hear it and find it. And it's difficult. It's difficult to do sometimes, but if you invite in the conflict, one of the, we have some people from our community here, we do a lot of working groups. Working groups are places where stakeholders from the community, either core or agencies, organizations, families, survivors, can help to guide the work of the Resiliency Center. And in those places, there's a lot of conflict. There's a lot of different ways to view the path forward. And it can be hard because one person's like, well, it's obvious we go this direction. But that actually, when we start to listen to each other, when we sit in that conflict for long enough, we find those working groups are areas where we learn about each other, where in the future, when there's something to wrestle, we have a better sense of each other, of what different people's edges might be around anything from the politics of the event or the spirituality space of the event or what is acceptable to say. So I would, just say that we have to create spaces for listening and for conflict. We call them working groups. I think different people have called them different things. But that our working groups, we're now thankfully about 6 years from the event, and we have some working groups where they have figured out how the path forward should go and can bounce things off of each other in fast time. It was very slow at the beginning, but it's much faster as the years go by, and they can work together and find agreement. I think that the fighting for the space for victims' voices to be heard, that getting rid of the flattening of the narrative, I can't, say enough about partnering with local media. I think Mayor Gainey really talked about what happens when that doesn't go well. We have really found that finding and sort of rather than a defensive strategy, an offensive strategy with our media, encouraging opportunities for the victims and the community impacted to find their voice, to be able to get it out there, and that we can be a conduit of that by carving out that space, because their voices, I think it's come out a lot today, that survivor voices have so much to teach our communities, and sometimes it's actually just making sure that they have that space to do it. It's, one of the biggest challenges to that is that we have to remove our own ego as a organization, right? So that might be the organization that's in response, the organization that's standing up the Resiliency Center, the emergency response organizations. There's a lot of people who have to remember that we are really just holding the space until and when the voices of people who have more moral authority, is often the term we use, more moral authority on the topic, to be the ones to speak to it. And so that means that you have to be ready to be adaptive, flexible, change course, and know that it may not be how you envisioned it. And so I think to the question, like, that was a very concrete example for us, is what do you do when the AEAP grant, when our Resiliency Center's, foundational grant ended? Do you continue? Do you end? Do you sunset? It's a hard question that every community faces in that medium to long-term recovery. And, we did a strategic planning process that I really feel proud of, because it wasn't the outcome that I had wanted. The community spoke, the strategic planning process was very thoughtful and brought in so many different data points that I am really happy with what it was. But if I had been, somebody who's been invested in this work for over 5 years, had been given the decision point, I would have made a different decision. And I think we came to the right decision. But it took sort of some deep listening and really incorporating all of those different data points to be able to get there.
We'll have a question, I guess we'll maybe go down for everyone, about what are some overall lessons learned or trends that you're seeing in the mass violence space, whether it's preparedness, response, or recovery, that you've sort of observed in the past few years. And I'll start with you, Pam.
I think what I learned in our last training, our cultural competency training, was that originally we were separating cultural competency kind of as a module, and then in the end we wove it into everything. So I think that what I learned was that it's not just it's something that is woven into everything that you do, that it's not something separate. And so I look at all of the materials that we have, our language access plan, and I think that going forward, we'll make sure that it's part of our practice, as opposed to that it's part of module of anything that is added on to our training materials. So I think it's really changed the way I look at all of the services that we'll provide and the way that our organization will run moving forward. So that it's been really a gift in a way to do this work and to, those lessons learned for our organization. So that I'd say that's our best lesson learned.
That's you, Maggie.
I entered this work because I'm a community member. I want my kids to feel safe in the same community I grew up with, being Jewish. And so that's why I entered the work. And so I was really deeply invested in what it would take for our community to be able to heal. And I would say at the beginning, I thought somebody was going to give me an answer of what would happen, and there was no answers. But so what I've seen in the last few years is so many more mentors, so many more opportunities to learn from each other. And though there's not the roadmap that I had hoped would maybe exist, I think now there is, I was just trying to grab bits of wisdom that I could that would tell me a little bit of what to do best. Now I realize that there's so much more wisdom. It's written down. There are so many more people who are spouting that wisdom. And I believe that, to Mayor Gainey's point, that I think that part of that is investing in the future, because we have to remember that not just hurt people, but healing people heal people. And that the more we have communities of healing, the more opportunities we have to name pain and to try to deal with it in the time rather than let it fester. So I'm hopeful in that vision of what's changed in the last few years.
I like your term, healing people, heal people. I'm really focused on that. Thank you. Stacy, how about you?
So when I think about trends, the very first family assistance center I ever supported was after 9/11. And so being able to see what has happened in the 20 plus years after, right? And so I think that some of the trends I'm seeing is actually having victim services providers at the table. It used to be emergency management running the show and doing all of it, right? But now having victim services providers learning the language of emergency management and vice versa, and creating these kind of circles just like this, the summit, where we can kind of bring everybody together. I think the most important trend is actually listening to the voices of the survivors. I will be honest, I always say, like, it's an honor to partner with people, and sometimes their greatest time of need and tragedy, and the fact that they allow us to do that and learn through their pain, it's been a privilege. So I think to keep creating these kind of environments where we can hear from those most impacted, and it really is meaningful, and it makes it why we do what we do.
Thank you. Well, I made sure that we had some time to really be thoughtful and kind of have some interaction, right? So you don't just hear us hear me ask questions. So I wanted to take pause now and open it up to the group that are here in person here in Pittsburgh, to be able to ask some questions to our panelists around preparedness, response, recovery, trends in the field, evidence-based practice. We got a question over there.
Hi, I'm Rachel from Perf. One of my questions is about the Family Assistance Center. Who counts as family? We know there's so many models of what family looks like. So what does that look like for her?
You want to take that?
So, we don't sit there with the clipboard and say, this is the law here. And I keep going back to, and I think about some of the larger scale, responses and family assistance centers. And I think about Pulse. You had chosen family and biological family, and we didn't turn anybody away. And our numbers were out the window, and that's okay. We were prepared for it. And so it really is the community and who is the needs. Now, what can be complicated is that certain agencies will only provide services for that legal family. And I think about, sometimes crime victims compensation, it's legal next of kin. So that's when it can kind of be that gray area. But there's enough resources in a family assistance center that people can definitely, get the resources. But it really is up to each agency who's in there about what services that they can receive.
Thank you. We have a question down there.
Thank you for your commentary. So I have a question that actually came up in the panel before yours and also yours. All of you have spoken in some form or fashion about the need to build relationships before the actual traumatic event occurs. And I think we all can agree, right, that that's pretty obvious. But the challenge is to that is, I want to know from you what you believe is the biggest impediment that prevents that connection and that communication and that relationship building before the traumatic event occurs, and what you would recommend needs to be done for those who are practitioners and or have some play or some role in addressing these issues. Like, what do you think needs to be done to help facilitate better relationship building at the outset? So what's the impediment, and then what's the approach to address it? Thank you.
Great question. I have thoughts too, but I don't know if you wanted to jump.
One of the things I think is that just not being invited to the table and getting yourself invited to the table. I mean, getting connected with your victim volunteer organizations, active in disaster, your VOAD organizations. And, you know, I think sometimes the impediment is we don't know what's out there. The other thing is sometimes we are very siloed, and this is the work that we do and this is what we bring to the table. But I think kind of opening your aperture a little bit and figuring out, okay, how can I partner with these? So I'm sorry.
Oh, no. I think one of the other things, at least for me in my community in Charleston, is maybe you don't bring people to the table to talk about mass violence initially. Maybe you bring people to the table to talk about what are the actual issues that are going on in that community that needs to get addressed, and build some relationships and partnerships around there. So for instance, in Charleston, we did not have a victim service emergency response plan for mass violence before the Mother Emanuel AME church shooting. However, we had relationships with the providers in our community. We happened to have that, and it was because through other things we were interested in serving related to victim services. So sexual assault task force, domestic violence coalitions, other sort of outreach and engagement of issues that were important related to victim services in our community. And that's where we had some partnership, some alignment. And then when a mass violence incident occurred, we had some of those relationships. Now, there are some barriers that we experienced. We weren't connected with everybody in our community. We weren't connected with all of different community pockets that might be impacted by mass violence because they weren't invited to the table, or we weren't aware. And so I think it doesn't happen immediately. It takes time to create those relationships because trust needs to get built. I don't know if I completely answered that from my perspective, but for me, it takes time and intention and really understanding what the actual community needs are now. And then you can build on that when a mass violence incident occurs, and build in some planning for mass violence. If you had other thoughts there. Go ahead.
I think for us, taking the lead was an important part of overcoming some of that and doing the work. You know, what we noticed about our partners, especially state and county agencies, was the understandable fear that this is a heavy lift. This is a lot of moving parts and a lot of work. And so people's capacity to sign on is really limited because they're understaffed like all of us, you know, anybody who's working with an agency. And so what we found is that if we were willing to do the work, that the certain certain group of people that was really helpful for. It wasn't that they weren't invested in a way, but that it was really a barrier. So that in doing that, and also in providing value, I look at the trainings that we've done. We've done, 2-3 day setting up a family assistance center trainings. We did starting in 2017, 3 2-day trainings about mass violence. We just did the behavioral health trainings, which our Department of Health gave us $50,000. Our Homeland Security gave us, I think, over $30,000 to do these trainings because they didn't have the capacity to do them. It's anybody who's putting on anything like this knows what a burn it is to put together a big training. And so people were willing to invest in different ways if we were willing to take some of the load off of them. So particularly after our Maui fire, issues about cultural competency and behavioral health, the lack of behavioral health services really created for us the ability to bring all these partners in that weren't our partners before. And like I said, significant monetary investment in us providing that for a greater community.
Can I also just say that, the idea of kind of how can people prepare and get the right people to the table? You can't get everyone that's the right person to the table, and, responding to an incident that was anti-Semitic in a community that the Jewish community leaders had already been in relationship with each other. But one of the other major benefits was that we had our religious community leaders. We had religious spiritual leaders from across the city who had started conversations. For us, it was especially potent after Charlottesville and what had happened there, but that how they could be leaders. And so in some ways, I also think there's big ways that you can create the right table. And then there's also small ways that different communities can start to make a table themselves and then assert themselves in events when they happen, and especially in marginalized communities. I think that finding tables for more people to be at is absolutely an asset in the face of mass violence. And I think that one of the things that I would like to sort of shout out is the ways in which civic leaders find ways to find those community groups who are there. Later, there's going to be a credible messengers panel. And I think that that's an important message. Who are those credible messengers? How do you find them? And the more tables that exist where people are in unconventional relationship with each other, the more resilient the community will be.
We have a question from an online participant for Dr. Beers. If someone previously took the trauma notification training when it was the death notification training, should they retake the revised version?
I would think so, yes. The 4-step model is the same, but there's a lot more resources on the new training.
Question, were they?
Hey guys, thanks so much for this great panel. I'm a kid person, and I think it's important that we think about when these events happen in schools. It's really problematic when we don't see that the teachers or the educators that were in these incidences were victims, and that they are part of the umbrella that needs services. And we're talking about lead agencies. A lot of times education is considered secondary when they're actually the leads of their institutions. And so how are we building the partnership with schools and education and making sure we're doing a better job when these incidences are happening at schools and universities?
Go ahead. Your panels.
I think that that's a great question because, we know that mass violence incidents can happen anywhere. And I just think that, having those stakeholders at the table, in the aftermath of the Uvalde shooting, making sure that the superintendent came to actually see what the Family Assistance Center looked like, right? Because he had credibility with the schools. And so finding your stakeholders in the community that will go back and tell others, hey, this is an okay place to go. And these are the resources that are here. So I'm a big proponent of letting people come in and see what the resources are and then going back and telling their group. And that's a very simplified answer, but it worked really well for us in that response.
And I just wanted to add, Melissa, I appreciate that comment, because when an incident occurs in a school, right, the teachers are providers and everybody's focused on children, but the teachers are also trauma impacted, and that they may be victims themselves. So they're kind of, they're both. And we need to make sure we're helping those helpers so that they can best serve kids, and also just recognize that they're victims too, and making sure that they're at the table for planning as well, so that they're not left out. In addition, not only when an incident occurs in a school, but when an incident occurs in a community, because in communities, especially if an incident occurs where families are impacted, even if it's not at a school, those kids go to school, right? That's their environment that they live in. And they interact day in and day out with other kids and with teachers who often are sort of those first responders for those kids, because they see them day in and day out. So making sure we're including schools even in that concept of preparedness, even if an incident doesn't occur on school grounds, would be kind of some food for thought.
And I just also add hospitals into there too. Yeah. I think that it's really important for both schools and hospitals, where the helpers are supposed to only help in one direction, and the systems don't always remember to be trauma informed.
I think we have time for one more question. There's multiple hands.
I just wanted to highlight something Maggie was saying about the conflict, which is brought back a memory about being on the advisory board in Boston. And just the idea that all the survivor participation, everybody's at a different place and everybody needs something different. So month to month, year to year, my need might change. So what I'm bringing to the group is going to change. And then if the board always follows sort of that voice without having that check and balance system, we're not everybody's coming along for the ride. And I think that sometimes exacerbates the conflict of like, now you're not hearing what I need. Why are you only dealing with what they need? But I think it's that sort of breadth of need and how do you bring the expertise from the center in to sort of help mediate that survivor voice too, and then provide the education that, you know, your needs are just going to continue to change over time. I just thought that was such an important part that you brought up about that.
Yeah, and one thing I forgot to say was just that one of the things about a communal trauma is simply that people are going to have this inherent conflict about some people want to move forward, some people want to stay where they are. And that's a tension that is absolutely baked in, this desire to go back, right? Can't we just go back to how things were before? And you can never go back, but that's a communal pressure that exists, that is in tension with people who want to remember, who don't want to forget, who want to make sure they're carrying it forward. And that's a sort of built-in tension, and the timeline is different.
All right, we have, I think, just one more question. I see a gentleman with this, been very patient. Oh, two more questions. Okay.
Thank you so much,
you.
panel. Maggie, you talked about working groups, and that brings up a big idea in my head about how many and who facilitates those and who gets the green light to bring and to start those working groups.
Great question. There could never be enough, as long as they're not working on the same project, that we could never have enough working groups. But, you know, someone from our center facilitates all of our working groups, and that's important to have some professional staff person who is there, who's often responsible for kind of different areas of carry through, though they're never the one to direct the work, right? It's sort of the Resiliency Center being kind of a reflection of what the community desire needs might be. Those working groups are core for us to be able to meet that need. So being prepared to carry forward with the work, but also not to set the agenda of what that group will do.
Yep. One more right back in the back.
Make her answered.
And thank you for everything that's been said in both sessions. I'm inspired by what John said earlier about his first encounter with any kind of center, which is really the first engagement point for anybody who's going to be in the sort of the life cycle of receiving services through the Family Assistance Center. So my question is, how can we better incorporate disaster behavioral health in those initial moments? Because that's where we have folks engaged, and I think the rest of their experience is going to be governed by what that is and what is not. And unfortunately, people don't get really good at something unless you've had to do it before. We don't want to wait for people to have so many disasters that they get good at it. But every full-scale exercise I've done where there is a simulation of setting up that first center, they don't really test out the behavioral health piece or the affect that people are really going through. It's more like people standing in line for a movie. So I think we need to increase the sort of our integration into those testing moments so that the disaster behavioral health deployments are included so we can take care of folks. So I'm just wondering if you have seen opportunities for that across the different cities you've been looking at, different jurisdictions where emergency managers like myself can get that kind of approach or strategy.
Yeah, you bring up a good point, and I have several people on speed dial, and several people are in this room that are on my speed dial when I go out to communities, because, you know, these communities pay it forward. And to your point, we need to make sure that those lessons learned are being put forth. And so that's the most simplified way I can answer that, but you're absolutely right. I mean, you know, we're learning from each community and paying it forward. And I remember specifically, you know, going out to Las Vegas and they set it up and they were going to have a 24/7. And I was like, now this is interesting. We didn't do this in Orlando. And they said, well, we're a 24/7 city. And I was like, oh, okay. So I listened to what they said, but over a period of time, what they learned is that people weren't coming in the nighttime. So, but who was I to come in and say, you know, don't have it for 24/7. And so you've got to kind of meet people where they are and then try to bring in the folks that have that experience. So.
And to highlight the National Mass Violence Center, our ICP TTA. So we do provide some training and technical assistance for communities to kind of help do some tabletop exercises to kind of think through what preparedness, not just develop your plan, but what that actually could look like and play out. And we do have consultants from other communities that can help talk a little bit about that lessons learned. Thank you. All right. So at this point, we are going, thank you very much to our wonderful panelists. Appreciate you.
Yeah, I would like to thank the panelists. They had a huge scope to cover, and they really did highlight some very important points for us to consider. Thank you very much. The next group of panelists, please step forward. It's a delight for me to again reintroduce you to Ms. Maggie Feinstein. She is, as you know, the director of the Healing Partnership 1027 and a member of the community of Pittsburgh. The other secret is that she is one of the instigators for the development and establishment of the Resiliency Directors Forum, which meets monthly. So we owe a lot of gratitude for her ability to speak to her needs. Thank you.
Thank you. And hopefully you won't hear that much from me since you just heard from me. And I'm sitting with two incredible leaders who you'll get to hear from. I really don't need to do much because this relationship's so meaningful, but I will say to tee it up, one, I'm not going to read their bios because we don't have enough time and you should read them. They are on the Whova app. And then two, that I am going to, instead of reading their bios, just sort of place that after the shooting, there's in Jewish tradition, you do Torah study often to honor those who have been deceased. And one of the Torah studies I did early on was around Psalm 23 and about why in Psalm 23, if people aren't familiar with it, it is read in most faith traditions, but the Lord is my shepherd. I lack for nothing. He makes me lie down in green pastures. He leads me beside quiet water. He refreshes my soul. He guides me along the light path for his name's sake. Even though I walk through the darkest valley, I will fear no evil, for you are with me. Your rod and your staff, they comfort me. So that passage was one of the first Torah studies I did after the shooting, and the idea of why are we not alone in the face of grief and trauma, and what kind of do we find comfort? So in our panel today with Rabbi Myers and Pastor Manning, I want you to know that this relationship is really the model of what that looks like in human form. What does it look like to not walk alone? So I'm going to start then, Rabbi Myers. Can you tell me how you met Pastor Manning?
I think it was the Monday or Tuesday night after the shooting. I was sitting in my living room and tried to make my house the sanctuary to escape the rest of the world, which was not an easy thing to do. I was lucky. I only had one reporter show up at my door. May that reporter rest in peace. Only kidding. You know, when you sit with your email on your phone and you scroll like one of the one-armed bandits in Las Vegas, scrolling, I'm going, oh my God, look at all of these emails. That's after our server had crashed from all the emails. And it just stopped. And it was an email from Mother Emanuel. I'm going, I know the name, and I'm just thinking, where do I know the name? And I remembered why I would know that name. And I opened up the email. And Pastor Manning had sent an email. The essence of was he was coming to town. And I'm thinking to myself, oh, great. I've had thousands of people come to town already. I don't need another one. I can't host. Anyway, he was insisting he's coming to town. So for whatever reason, the email, his insistence drew me. So that Friday morning before the last funeral, we met for coffee and sat for like 3 hours, I think, in your hotel restaurant, and just talked. And I learned the most incredible phrase, which doesn't exist in Jewish practice exactly, called the ministry of presence. For those of you who know it, I don't have to explain. For those who don't, it meant just to be there. And why? Because this man understood, I need someone to just be there. So as our conversation was concluding, because the funeral was, I think, 1 o'clock, he asked if he could attend. And I said, not only can you attend, you're going to come up with me, and I want you to recite the 23rd Psalm, and then share whatever words of comfort moves you from your heart. So imagine the look on the faces of all of these people in a 2,000-seat sanctuary when a rabbi walks in with a black pastor. And they thought, is this the start of some joke that we haven't read yet moment? And then I said to them after the introductions and so forth that I believe in angels. Now you may say, this poor man, once this funeral is done, the men in the white coats need to take him away. He needs serious help. And no, I believe in angels and that God does send angels. And I want to introduce you to my angel, Pastor Eric Manning. It grew from there to that. I think you were the one who said it at some point along the way that we're brothers from different mothers. But it's just grown to that extent that he's my pastor and I'm his rabbi. And I'm grateful for your presence in my life.
Thank you. And so Pastor Manning, you were not present in 2015 when the shooting happened, and you have been an incredible leader since then, taking your community through the recovery and sort of rebuilding period. How did the shooting at Mother Emanuel impact your faith?
Wow. All right. So personally, of course, when the tragedy happened, and you're far away from it, maybe an hour or so, you don't necessarily have to deal with it, right? You have to deal with your own congregation that you're serving at the time, and you kind of just, navigate or assist them in navigating through asking some of those challenging questions. But then when you come to the place where the tragedy happened, then it takes on a completely different meaning. No longer do you have the opportunity to try to figure it out, but you have to learn quickly and continue to develop empathy and be confident in sharing with people the truth that you don't know what you don't know. And as we were talking about the 23rd Psalm was the first sermon that I shared at Mother Emanuel. So it's very wonderful how God is working. So in that particular perspective, it was sharing with the congregation, I do not know how to lead you. And I did not. But I shared with them that God knows how to lead us and God knows what we need and he will take us through it. So it was just reminding everyone of our faith tradition and how frequently we read and recite the 23rd Psalm, and then trusting and believing that the same God who was with us before the tragedy would continue to be with us and show us how we ought to navigate through this. Very challenging. I make no secrets about it. I made mistakes along the way. But God was gracious because I want to say my heart was always in the right place. I did learn what it means to be trauma informed. I learned quickly, reading quickly, serving quickly. And Rabbi brings in the whole aspect when it happened in his community. I did not want him to go through it the same way that I did. So things that I learned, things that I painfully learned, nights that I cried, nights that I had more questions than answers, I was hoping that I could share with him that same wisdom. So our community, of course, processed and continues to process it. 9 years later, we're still working through it because it is a continuous journey. So.
Thank you for that. And I think, if there's ever been a vision of what Ministry of Presence is, it's exactly what you're describing. And so Rabbi Myers, will you share a little bit about kind of your faith in the aftermath and, how you've reconciled that?
I expected to die that day. And in the Jewish faith, we have a final confessional text to be recited by someone who's in their final moments. In most cases, people at that moment are not physically able to. So I, as a rabbi, will hold the hands of the family. We gather and we recite this final confessional together. One would never expect in their own lives that you'd be holding the phone to your ear with 911 and ask them to just pause and then recite the final confessional for yourself. And I had strong enough faith to know that if this is what you want of me, God, I accept that. But if the shooter comes, I'm going to fight like hell. And whatever is to be, but that I don't hold God responsible for what is happening in that regard during that day. In the end, my faith grew. I was rescued by 4 SWAT team members. I call them my angels. In Hebrew, we call them a seraph. A seraph is a fiery angel with a sword. So they were my 4 angels that came to rescue me. But in the aftermath, the first few days, I couldn't pray. I lost my prayer voice. Couldn't get a word out. There was a memorial service at a local Jewish day school. My wife's on the staff there, and they invited me to just be there with them and maybe say something. And as they all stood up to participate in certain prayers, I couldn't pray, couldn't get it out. I had to leave the room because I lost it, because it had never happened to me. And I then said, okay, where do I go to find my prayer voice? Who would have experienced what I did? There is no rabbi ever in that regard who experienced in America what I did. This is the first time ever. So I turned to my tradition, to the Psalms, because if ever there's a biblical hero who went through the ups and downs, it's King David. And I started reading the Psalms. It took till I got to the 121st. There's 150 of them. I went through all of them till I got to the 121st. I lift my eyes to the heavens from where my help come. My help comes from God, maker of heaven and earth. That began my path of healing. To this day, 5 years and 9 months later, I still recite the 121st Psalm every morning as I start the day. So I found renewed faith in the fact that God had a mission for me, that I'll never understand God's ways, but if this is the mission and this is what you want, and your answer is no, I'm not ready for you yet, I have something you need to do. The answer is, just tell me what it is, help guide me. And if you have extra time, help put the words in the right order for me. That was the beginning of finding that faith, because before I could lead a congregation in any regard, you can't do it if you don't have it yourself. So I would have been totally worthless to the congregation without. That's the challenge that I face every day, of being a survivor of a shooting, as well as being the pastor to a congregation simultaneously. And that proverbial scale goes like this, not just every day, every minute of every day, the scale keeps going like this. But my faith grew and continues to grow because I have faith in God.
Thank you for that. And I think, given the nature of this conference, we're talking about different incidents of mass violence. And when a house of worship is the place where mass violence comes, then what does it look like to respond? And I think what you guys both just shared in terms of your willingness and ability to really go there, to not try to just sort of fake it, but to be curious, to not have the answers, to keep looking until you find them, is a unique aspect to what happens when a community at a house of worship is the target of mass violence. And I think, my question for you both as how important is it for a congregation that has been the victim to lament following a tragedy? And to some degree also, what's that period of lamentation look like for a congregation?
You first for me.
You get this one.
I get this one. Okay. So with the tragedy at Mother Emanuel, everyone remembers that the families forgave. And it was almost as if I dealt with this for the first time in 9 years this past commemoration period. We went from tragedy maybe to lamenting, but jumped right in forgiveness. And that's what then took the narrative. Everyone grabbed on, oh, a tragedy happened, but the families forgave. Now we all have to forgive. They did not take the time to reflect on what just happened. The community gathered around wonderful aspects. Those in Charleston would remember we gathered, we walked across the bridge, Charleston strong, Charleston strong. We did not lament and take inventory on the racial act that took place. And subsequently, through the process of time, people have always focused on, oh, well, this church forgave. This is a wonderful institution, a wonderful testament of your faith. But there were people who were still hurting. I don't know if she is here. I heard the story of the immediate Sunday after the tragedy that the church doors were opened, which, is a great saying. But you had members of the congregation in corners weeping. So there's a disconnect. And sometimes we have to figure out how much time do we spend in certain, perspectives. The tragedy happens, there has to be a time of lamenting and dealing with what has just happened, coming to terms with it, and then understanding that not everyone, I think I heard this in a panel just a few moments ago, not everyone's going to be in the same space. There are some who can just move quickly because they may not necessarily be that involved with what just happened. So through the past 8 years, I'm thankful longevity has its privileges. I've come to know and understand to a degree. And when we came to this commemoration, unlike any of the other ones, I finally took that step and said, I will deal with the Bible study, because I got a little concerned with people missing the mark, and they needed to understand what was happening privately, and I addressed it publicly. The congregation jumped from the tragedy to forgiveness, and we didn't lament. Subsequently, we did not deal with that hurt. So it took time. And that's why, of course, when we were working through the whole grant and everything else, and they have this timetable, I began to wonder, is 3 years really enough? Because realistically, in 3 years, people are just coming to grips with what just happened in their houses of worship, because that was their place of their fortress. That was their solitude. That was where they came to receive a word from God and to experience community. That has now been violated. So, and then of course, I was the third person in leadership to come in that particular instance. So you have to build the other aspect, which is trust. So you have to give people opportunity to acknowledge what happened, to lament, build trust, which takes time, and then they begin to open up. So even as now 9 years removed, there are still periods when the congregation goes back to that place. So I would say the lamenting period is ongoing with a person who has lived through it. And then, of course, you have the racial act that happens, right? Which in every other instance, when there is a tragedy that happens as a result of someone's race, religion, ethnic background, etc., it takes us all back. And that's something that we have to all remember and realize and recognize. And I shared that with a group maybe about a year or so ago, because when racism rears its head and it takes people to a place where they know firsthand the results of what has just happened, it puts them back. So it's not one like, that we may kind of say, okay, well, here's a nice little algorithm that we could work through. But when it comes at the hand of other individuals based on the H word, it has a different impact. So to answer your immediate question, I think I gave you enough things to kind of process through. Lamenting takes time. There is no real timetable for it, but those who are a part of those communities must understand, and they must be willing to give as much time as needed for that individual to come to grips and to terms with what has happened in their house of worship.
Thank you so much for that. Can I sort of ask a clarifying question that what you're saying is that the period of lamentation needs some leadership to encourage, because you were sort of saying that?
Yeah. You need leadership.
I mean, I'm serious. Is that what sort of would you have done differently in leadership? Because that's sort of what I was hearing.
Boy, okay. So yeah, okay. So leadership needs to understand that not everyone is going to come to the same conclusion at the same time. Leadership has to understand that we are all individuals and that we must create the safe space and give folks the permission to be there as long as they can, but never giving in to complete and total despair. Rabbi shared with you again, Psalm 121. That's why we are so close and we don't even realize it, because Psalm 121 is one that I have reflected upon for the past 8+ years. And it gives people the opportunity to just be in the space, but not necessarily giving into complete despair, because that's the exact opposite. You want to make sure that you still give them hope that it will get better. So I will continue to look to the hills, knowing that all my help is coming from the Lord. Did I answer your follow-up question?
Very, very well.
Okay.
Thank you. And very succinctly. Rabbi Myers, can I have sort of multiple layered question. I want to stick with that lamentation question, especially in terms of leadership. And also, I think that Pastor Manning mentioned the H word. If you can share a little bit about your philosophy on kind of why you've pushed that agenda.
I think it was November 9th, 2018, the city of Pittsburgh, under the guidance of our former mayor, Bill Peduto, called for they called it a rally. I don't remember whatever the term was, at Point State Park. For those who are not Yinzers, that means you're not locals. Point State Park is at the confluence of the three rivers here. You've got the Allegheny and the Monongahela merge and become the Ohio River. For baseball fans, that's where the Three River Stadium used to be.
We're going to make everyone say Monongahela later, just so you know.
Yeah. So I was asked to speak. At that point, I was spoken out. The batteries just were not recharging. And I had no idea. And I laid awake the night before. I have no idea what I'm going to say. As I was called up to speak, it was like this inspiration just came to me right at that moment. And I'll use the word once, hate. And I made the point to those in attendance in a typical light, misty, rainy day, because that's Pittsburgh about 300 days out of the year, that when you use the H word, as I now call it, and you say you H someone or something, it's a really powerful word. And when we use powerful language, it inevitably becomes emotional, and emotions lead to frequently really bad choices and violent actions. So, as I said to them, if you don't happen to be a fan of a certain New England football team, just say, I don't like them. If you are not a fan of Brussels sprouts, of which I am, say, I don't like Brussels sprouts. If you don't like today's Pittsburgh weather, live with it. But you could say, I don't like it. And I took a pledge, I will never again use the H word. And it seems simple, but guess what? It's really hard. I can't tell you how many times, like when I'm in the supermarket shopping, people are picking up a wagon. You always got that one bad wheel that keeps spinning around, right? And what do you say? I H when this happens moment. We use it all the time. It's that if you tone down your language, you tone down your emotional response to the moment. And if you could tone down your response, maybe it won't lead to a really bad path. So I took the H word pledge. And I said, to me, it's a 4-letter word. It's an obscenity, like all the stuff I grew up as a kid, you're not supposed to say, despite the fact that all social media is flooded with it, and so forth. To me, it's still despicable. Don't say it. There are other really great 4-letter words. Love, hope. Those are good 4-letter words. Stay away from it. So that was the simple origins of that, and ask people to take that pledge.
And I think has also been part of your leadership in terms of this period of lamentation. Like, I actually think those two things come together. Can you speak to that?
Yeah. So I went to Jewish sources. We've got a rather lengthy history with some lamentable things that have happened to the Jewish people. I've been reflecting upon that ever since the year before in Charlottesville. When you have a bunch of white men with torches saying Jews will not replace us, I think, in America? Is this America? Or am I in Nazi Germany in 1933? And at that moment, I said the door was opened to make anti-Semitism permissible in the United States. On October 27, 2018, they blew the door off the hinges. It has become very difficult to be a Jew in the United States ever since. So where do I find hope for my congregation? But not just my congregation, but everyone, quite frankly, because they don't just come for the Jews. Someone who's anti-Semitic is also against many other groups. And the funny thing is, those people who profess to love America abhor 60% of the people in it. So I don't get the math. How can you love America and despise the vast majority of the people who live in it? The two are incongruent. But where do I tell my congregation? We have a tradition at our Friday night services of an opening section of psalms and hymns to welcome the Sabbath. There's a tradition that mourners, the first week of sitting Shiva, as they mourn, they wait outside and don't come in because it's supposed to be joyous. So the first thing I instituted that Friday night was, as a community, we're mourning. We're not going to say that opening section. And when it comes to the mourner's prayer, some of you in the church would know it as the doxology. We're going to all stand and say it together because we're a community in mourning. So for the month, we did not say that opening section, and we stood and mourned and said the mourner's prayer. Many of my congregants continue to do that. It's traditional that for a parent You say the prayer for 11 months. Most people just stood, and to this day, most of my congregation still stands 5 years and 9 months later and still says the mourner's prayer. But I needed to find where are places that people can have touchstones to help them in the healing process. We have not been inside the Tree of Life to hold services since the day of the shooting. I think it was the prophet Jeremiah, but I could be wrong. It might be Ezekiel, who had said after the destruction of the first temple, they've defiled my house. And that was the attitude of 99% of my congregation, and that they couldn't go back in. So on top of not merely of suffering the loss, we were now homeless. And then on top of being homeless, we then had COVID. So we became homeless twice. That's really hard to rebuild community, because the glue that holds community together frequently is their building. And despite best efforts to say, wherever we gather, we are Tree of Life. It doesn't matter. If it's in my backyard sipping some really nice scotch, we're still the Tree of Life, which we do, by the way. No matter where we are the Tree of Life, but it still isn't the same. And until the day that the building is reopened, which God willing will be in my lifetime, for many, it will be hard to say that we're the Tree of Life until we're together in the building. There will be people who will never come back in again. I have people who lost their faith, so that the shooter didn't just steal lives, he stole faith. And despite today being Amazon Day, you can't buy it at Amazon. You can't just restore it like that. There are people who lost it, who have never come back. I know people who won't come back. If I could take 100 of my congregants and put them in a room, each of them would be in their own slot. They're all in different places. And there are those who say they're healed, and I say, God bless. For me, I will always be healing. It's an active process, but I respect those who feel that they are healed. I created a new liturgy. We have on our holiest day of the year, Yom Kippur, it's called a martyrology. The sense of the martyrology is to recall over the centuries Jews who have died because they were Jewish. And it covers from the earliest days of Jews up through the Holocaust. Well, according to the legal Jewish definition, the 11 people who were killed in our building were killed because they were Jews. Therefore, they're martyrs of our people, even though I know and I respect that the victims' families prefer that they're called victims, but from a legal point of view, they're martyrs of our people. So I created a brand new martyrology. And believe it or not, I found a lot of poems written about Pittsburgh. I incorporated those in other readings and created a brand new martyrology. So on our days when we do the martyrology service, which is done 4 times a year, we do a 2-part martyrology. We do first for the 11 victims, but I also include the one victim from Poway, because I won't let her name be forgotten. Lori Gilbert Kay, may her memory be for a blessing. As well as we do that section, and then we do this section for the remainder. So I've tried to say, how can I retool a 4,000-year tradition to make it modern, to make it appeal and speak to my people? And it's through attempts like that that I'm just trying my best. I have no guidebook. There's no place I can look to read what Rabbi so-and-so did, because it never happened. So I'm just a mere human being, despite John Berman from CNN's assertion that I'm America's rabbi. So what that means is trying to tackle 3 pots at the same time. The needs of my congregation, the needs of the world, and then the needs of my family, which frequently is the one that suffers the most, regrettably, as you well know. And try to balance those is just impossible. And at the end, when I'm judged, I accept whatever that judgment is, because I'm a mere human being. I'm imperfect, and I just tried my best.
Thank you both so much. I think, I want to say on behalf of the congregants who are currently going to your services, as well as those who may take longer to come back, thank you for being leaders through hard times. It's so important what you just shared. And I think that for all of us working in the mass violence space, to be able to hear what leadership looks like from a spiritual perspective and how you guys have been able to carve out, a trauma-informed ministry and been humble enough to pivot when you had to pivot is really remarkable. So thank you for sharing your story. I know people are probably wanting to hear more because it is really so beautiful. And you're going to have to hear that over lunch or find them somewhere else because we're not going to have time for questions right now publicly. But thank you both so much.
Pastor Manning, Rabbi Myers, with our gratitude, thank you for sharing your relationship and your witness. We're better people. Again, I also want to acknowledge and thank all of our speakers and panelists this morning. This is concluding this morning's presentation.
Welcome back to the training portion of our virtual summit. We have just over 3 hours of inspiring speakers, tips for mass violence readiness, response, recovery, and resiliency, and some great resources to help you prepare for and respond to mass violence incidents in your community. I'm Ann Seymour, the Associate Academic Program Director at the National Mass Violence Center, and I will be co-moderating our virtual summit today with my great friend and colleague, Dr. Kevin O'Brien. Hi, Kevin.
Hi, Ann. Thank you very much. My name is Kevin O'Brien. I am a consultant with the National Mass Violence Center, and I have been privileged to be a facilitator for the Resiliency Directors Forum for the past 4 years. And it is my honor to introduce the director of the National Mass Violence Center, Dr. Dean Kilpatrick.
Thank you, Kevin, and welcome again to our summit attendees from all across the United States and around the world. This morning, we heard from federal, state, and local leaders who know firsthand the importance of our work and its positive impact on communities that have experienced the horror of mass violence, as well as other communities that simply want to be better prepared. This leadership begins with the U.S. Department of Justice and its Office for Victims of Crime, and we are grateful to them for their support of our center and of this summit. We heard from mass violence survivors who advise our center on a regular basis through our Survivors and Providers Committee and our Resiliency Center forums. Throughout this afternoon's training sessions, please keep in mind that the power of personal stories of mass violence survivors is foundational to everything we do, and it keeps us focused on identifying and meeting their needs when mass violence strikes a community. They are the true experts on mass violence, and we must listen to them. A truly heartwarming outcome of mass violence tragedies is the willingness of people who have experienced mass violence to share their lessons learned with communities that have not yet experienced mass violence. This afternoon, you'll learn about some of these best practices. And I'm extremely grateful for our Foundations of Faith panelists for reminding us about the importance and value of engaging multi-faith communities in all of our efforts related to mass violence preparation, response, and recovery. The hashtag of our center has been Know Before You Need To. That is the ultimate aim of today's summit, to help you know and understand the devastating impact of mass violence incidents, and to be able to collaboratively plan effective responses, recovery efforts, and activities that strengthen survivor and community resilience. And now I'm pleased to introduce Renee Williams, who is the Executive Director of our summit's co-sponsor, the National Center for Victims of Crime.
Thank you, Dean, and thank you all for joining us for this incredibly important initiative. As we know, the impact of mass violence is far-reaching, impacting not only the immediate victims and their families, but also the broader community as a whole. And we know the road to healing and recovery can be long and challenging. In assisting communities through these crises, we have learned that collaboration is key in ensuring that victims receive the care and resources they need to heal and move forward. Resources needed are often wide-ranging, from counseling to funds for work or lost time, from enhanced law enforcement presence to spiritual guidance. At the National Center for Victims of Crime, we are committed to fostering collaboration among law enforcement, mental health professionals, community organizations, religious leaders, and other stakeholders to support victims of mass violence. Through our collective efforts, we aim to provide a comprehensive, compassionate response to those affected by tragic events. Today, we've been exploring the importance of collaboration in the aftermath of mass violence incidents, and I encourage you to listen for ways that groups have found that working together has helped better serve victims and strengthen communities. Thank you so much for joining us at this important summit. I'm so eager for us to learn from each other how we can best support victims and uplift those who have been impacted by violence, building a more resilient and compassionate society for us all. Now, Anne, I'm going to turn it back over to you.
Thank you so much, Renee, and also for emphasizing the importance of collaboration. I think you know how much we appreciate our ongoing collaborative efforts and our partnership with the National Center for Victims of Crime. So we have a very ambitious schedule for y'all with excellent speakers and resources. And here's just a quick overview of where we're going this afternoon. We're going to start with the power of the personal story directly from Pittsburgh. And then we're going to roll into the three core aspects of mass violence, and that is preparedness, response, and recovery and resiliency. And then at the end of today's summit, we are going to load you up with resources available from both our center and the National Center for Victims of Crime. The always important housekeeping announcement. Try as you may, you will not be able to use the chat function during the summit because our amazing number of summit registrants made this unfeasible. However, please feel free to drop any questions using the Q&A function. After the summit, our team is going to try and answer all of the questions that are not covered within our sessions today. You'll receive our Q&A answer key along with the link to our extensive virtual summit resource guide that features a treasure trove of helpful information. Finally, we're going to provide a 2-minute break between each session today. We recognize that we'll be engaging in some deep discussions, and so these mini breaks and our 15-minute break following the preparedness session will allow you time for a little stretch or mindfulness or a cup of coffee. So thank you for joining us today. Welcome back. When we began planning our national summit and this virtual summit, we knew that we would want to host it in a community that had experienced a mass violence incident in order to highlight that community's response, recovery, and resiliency efforts. It's an honor for us to be in Pittsburgh, Pennsylvania, a community that experienced a horrific identity-motivated mass shooting at its Tree of Life Congregation's synagogue on October 27th, 2018. It's a community that demonstrates to all of us the possibility of resiliency and growth in the aftermath of a mass violence incident. So now we'll hear about the power of the personal story of Pittsburgh from Maggie Feinstein, director of the 1027 Healing Project Resiliency Center, and Michelle Rosenthal, the sister of Cecil and David Rosenthal. Welcome, Maggie and Michelle.
Thank you so much, Anne. I'm humbled to be here with my friend Michelle and to be able to talk to you all. I am the director of the 1027 Healing Partnership, and we were started in the aftermath of the shooting at the Tree of Life Synagogue, where 3 congregations were worshiping on October 27th, 2018. On that morning, a gunman entered the synagogue and murdered 11 people, and he also injured a number of other people, and after a gun battle with police, he was apprehended. So Michelle and I are here to talk a little bit more about her story, her family story, and also elevating for you all what some of the experiences are for survivors and families after an event like this. Michelle Rosenthal, in addition to being the sister of Cecil and David, is an incredible community leader She was my boss as I interned approximately 25 years ago, and that will tell you a little bit about our community as well. We are a very close-knit community and a very tight-knit Jewish community. And Michelle's been a leader working in the mayor's office, working with the Pittsburgh Steelers, and has, for that reason, you'll hear a little bit in her story about her connections in this community. So Michelle, thank you for being with us.
Thank you all.
So how did it come that Cecil and David were at services that Saturday morning?
My family, my dad's mom and dad were very connected to the Tree of Life Synagogue. My grandfather, who I'm named after, was a Torah teacher at Tree of Life and passed away before I was born. And when we were younger, my grandma would take me and my brothers Cecil and David to the synagogue every Friday night and Saturday morning. And as we grew up, I left for college. Cecil and David, as a very important side note, were both special needs individuals. They had something called Fragile X, which causes intellectual disabilities. But after my grandma passed and they lived in the Squirrel Hill community, it was very important for them to go to Tree of Life because they felt that it was their extended family, it was a safe place to go, and it was a place where they were welcomed.
And can you tell me a little bit about how they interacted with the Tree of Life community and sort of being Jewish in general?
I mean, they had been going there for so many years, as I said, and the congregants that went there on a weekly basis really looked out for them, gave them rides home, took care of them. They were their family. It was not just the Tree of Life congregation. There were two other congregations that were renting at the synagogue, Dor Hadash and New Light. And all of the congregations would welcome Cecil and David. Cecil was, as a lot of people described him, the mayor. He would greet people at the door, welcome them. David would make sure that they had a prayer book, and both of them just were very welcoming, loving individuals.
So when on October 27th, the shooting happened, how did you find out that they had been killed?
So my husband and I live 3 blocks from the synagogue, very close to where we grew up in Pittsburgh. And my husband and I were getting ready to run some errands, and he is a former public safety official. And he said to me that he heard a lot of sirens and something was weird, but I really didn't think anything of it. We got in the car to head out and his phone rang, and it was his daughter telling him that there was a active shooter at the Tree of Life Synagogue. Before I could even put the car in reverse, I knew that my brothers would go there every Saturday morning, and I immediately screamed out, "The boys are there," which is how not only my family, but the community would refer to them as the boys.
Yeah. So you knew immediately as soon as you heard that.
Yeah, I knew immediately that they were there. My husband, who is much calmer in these situations, and I am thankful for that, said to call their house. They lived in community housing, and said to call to see if they had gone to services that day. The individual said yes, they did. And I immediately called my sister and my parents. And I think all of us at that moment knew deep down, but obviously my next step was to try and gather as much information as possible. My husband thought that we should just stay home and see if we could get more information from the news and from calling some people that we knew. I couldn't stay at home any longer. And as I said, I was 3 blocks from the synagogue. We started to walk towards the synagogue, and there was an unbelievable police and public safety presence. It was almost like looking at a war happening. And my husband said, "Go and find somebody. I'll be right there." He needed to drop the car off because we were driving that way. And a couple people that I knew in politics, because it was around election day, there were some politicians there, and somebody grabbed me and said, "We need to get you in a car." And once again, at that moment, I knew that they knew something that I didn't. And I said to them, if you do know something, you have to tell me. As the day progressed, I heard that my brother Cecil was seen on the ground. Once again, not formal confirmation. And then the Jewish Community Center became the point for families to gather. And it was probably, it took until about 6 or 7 o'clock before the FBI would formally let the families know. We were all just in a room. For the most part, none of us knew each other. None of us really had connections. I knew one of the families because I was friends with the woman's son that was killed.
So it was about 9 hours between the beginning of the shooting and the families having confirmation. And I think, you know, familiar to people doing this conference is that the Family Reunification Center is what they call what was going on at the JCC. And so, you know, generally, as I mentioned, we have historical contacts that it's a fairly tight-knit community. But you said when you looked around, you didn't really know anybody. After sort of we started moving in the days and weeks and months that passed, what happened in terms of getting to know each other? And what's the experience like for a family of a victim to figure out where to go from there?
Well, first of all, it's really interesting. I have had the honor of getting to know families of other mass violence, people from Parkland and people from Poway. And it's just, they become part of my new family as well. But we all have the same experience, which I think is really important for people that are working in this field to understand. Obviously, that first day is shock and just extreme shock. And my parents were in Florida. They had to get home. It was the most horrific thing to have to confirm to my parents that both of their sons were killed. My parents decided to raise my brothers at home at a time when people who had mentally challenged children were told to send them to institutions. My parents refused to do so. And my parents are two of the most amazing people that I have ever met.
Can you describe a little bit about what their relationship was like with Cecil and David?
Yeah, I mean, Cecil and David, you know, lived at home for a long time. And then my parents knew that there would be a point in their life that they would not be able to take care of Cecil and David. So they worked with an organization here called Achieva that provided housing for these individuals with supervision. And the boys loved my parents. They each had their favorites. My mom's favorite was David and my dad's favorite was Cecil. And it really wasn't favorites, but it was kind of who they cling to. But Cecil and David were so, as Maggie had said, our community is so close knit. Everybody knew Cecil and David. More so Cecil, because he did not miss an opportunity to ask for a ride home instead of taking public transportation. If there was an opportunity to get a snack from somebody. David, on the other hand, was quieter, loved going to the local police station and firehouse, which is about 2 blocks from the synagogue.
Sorry, so I have a story about your parents coming home. So your parents arrived and you had to tell them.
Yeah, so I had to tell them, and that moment is, it's probably the hardest moment to talk about, to have to look at my parents coming off the plane. And I just shook my head, yes. And it was a horrible, horrible moment. And then unfortunately, you just have to quickly move into the next steps of planning a funeral that is totally unexpected. And not just unexpected, because that happens in our lifetime, but so public, which is something I could have never prepared for. And I would have never expected what the days and months and years ahead would look like.
And so you're saying the people who have been through a similar traumatic loss that happens really quickly and is so public, there's something you understand about each other?
Yeah, I mean, everybody had similar experiences in what you called the family gathering space, or
the family reunification.
The family reunification, just that time of waiting for answers from whatever public safety officials are in charge. In our case, it was the FBI, because it was immediately a hate crime. And so it is so frustrating. It is so everything that you could imagine. I mean, just waiting for an answer is the worst thing. And actually, we weren't getting answers. And I understood that it was probably a horrific scene from what I could unfortunately gather. But the FBI did not want to give confirmation until they were absolutely sure. We actually, the people in the room who have now become a huge part of my life, said how many individuals have been killed, because people were trying to figure out if their loved ones were taken to a hospital, because we heard some people had been taken to the hospital, and we were trying to figure out how many were killed. The number was 11. My sister asked, if you're missing or if you have not had contact with your loved one person from your family stand up. If you're missing more than one, the appropriate number of people stand up, and 11 people stood up. So we figured out how to find out on our own.
Yeah.
And it was a couple more hours before we were pulled into a room and officially told.
Yeah, so in such a tight-knit community, in some ways, the waiting was the traumatic part, but on the other hand, there was already a lot of knowledge just because, and there weren't that many people in the building at that period of time, so the people who were out, people knew. Can you share a little bit about, in the time since this has happened, what have been some of the bright lights of this journey? What have been some of the areas where you have found, if not healing, at least new learning, new knowledge, new things?
I would say one of the most, I'm not sure how you would describe it, good things, but it was about a month after the shooting. And like I said, my family did not know really any of the other victims or their families. So I asked some people in the community to get us together. And I realize now that the community also was traumatized from the events on October 27th. But my sister and I took it upon ourselves to reach out to the funeral director and other people and ask permission for the families to give us their number. And my sister and I pulled people together, because what we found out or what we realized was starting to happen is we weren't talking, and we were trying to understand what the journey was going to be, that other people were speaking for us with no knowledge of, how to find out information, what the legal process was going to look like. So often, and I get so angry, you'll have an elected official get on TV after a mass shooting, and they say, we're going to prosecute and we're going to go after this. And they honestly have no idea what they're talking about, because until the legalities are worked out, it's a misinformation to the families.
Yeah, and I've seen that that's one of those trauma cues for people, the reminder of there will be swift justice, we'll do the full extent of the law. But when you've been through this, that journey is not as simple as what it sounds like when they say that.
Right. And to go back and answer your question, one of the bright lights is some of the families that we have gotten to know. The bond is so strong, and we are there for each other. It has now been 6 years almost, and we understand that each other is going through different journeys. Our ups and downs are not the same, and we have to just be respectful of that. It has not all been good along the way. Maggie, thank God for the 1027 Healing Partnership, which is one of the most amazing resiliency centers. I think just from learning about others, just mobilized pretty quickly, and ever since have been a source of comfort, gathering, providing support through the trial. We would have never made it through the trial without them.
I was going to actually say, just building on that relationships piece, you and your sister advocated early, realizing you needed to have relationships with each other so people weren't speaking for you. How did that come? The trial happened last summer, so almost 5 years after the event. How did you see the benefit of that through that trial process?
The benefit of the trial?
Of the relationships that you had.
Oh, just being there for each other. There were a lot of people. I went into it saying that I think I would be there a lot. Some people said that they'll go on certain days and then they'll decide. And I would say 85% of the families were there every day, every minute of every day that the trial was in session. So
3 months.
yeah, and I feel like it would be a much longer conversation, but watching the process of selecting a jury, to know that other people in our community had been willing to commit their time to make sure there was justice was really important to us to show them our support, as well as the prosecution team, who were unbelievable. And they just kept in touch with the families, explaining stuff to us, letting us know, because it's not us versus the perpetrator, it is the government.
So I'm just gonna ask, there's a group of people who'll be watching this who are leaders in their community, either civic leaders, community leaders, first responders. What are the sort of two main things you would want them to know about your experience, and what do you wish people around you had known? Like, what would be the pieces of advice you would leave them with for how to support survivors in the best way?
I think a couple things. Most importantly, listening to the victims, listening to the families, hearing what their needs are. Don't assume that you know what is good for them. And kind of connected to that would be, do not speak for the individuals. That was a big frustration for me, is how many people were talking about how this affected them. And I am very possessive, as Maggie knows, of you don't know what it's like until you're that family member, or watching my parents. And I think all of us, all of the families of the deceased, felt the same way. There is not one roadmap in this. Unfortunately, when there is a mass shooting, we fortunately were a Jewish community that was affected, but when there's a shooting like in Buffalo at the grocery store, or other public places, at the Pulse nightclub, a lot of times there's no connection. So every journey is different, but I think listening to the victims and just really understanding what their needs are, and understanding that their needs will change over time.
And can I say, because I've heard you say this before, not assuming the worst about them, or that they can't advocate for themselves. You've been a very strong vocal advocate for yourself, but also that was easier because we're part of a community where you knew the people you were challenging. How could people who maybe don't know the victims as well make sure that they're allowed to be challenged? What are some of those things that you would often say, you guys aren't listening, you guys are doing this wrong, which was amazing, and it helped us change course constantly. How would you tell them to listen for that?
I'm trying to think how I would phrase it, but just, I keep on saying, just sitting down and listening to them. But what I also learned through this process, unfortunately, Maggie caught the brunt of a lot of my frustration and anger, but she also taught me patience, and to really pause and think about the other side. And I think that's something really hard to do. So if there's a way to just convey, not, once again, not telling them how to feel or how to think, but just making them aware of other things around that they might not be paying attention to.
Yeah. And I'll say, because I've heard Michelle say this, making sure that other people's egos are not getting in the way of her needs, right? That, which is, I think, a very fair criticism, is that as a survivor, sometimes other people's agendas, they wouldn't be listening, and she would often call them on that. But not everybody can do that. All right, so in our last thing, just will you say a little bit about the campaign that you guys started to honor the legacy of Cecil and David?
Sure, thank you. Very quickly, Achieva, who took care of my brothers in terms of housing and in terms of jobs, quickly mobilized in a beautiful way and started a campaign called Love Like the Boys. And it is the simple act of being kind to one another and doing random acts of kindness, which I know we hear over and over again, but Cecil and David truly did not know hate until the last seconds of their life. And it was at a place that they loved. So they possessed just amazing qualities. And I would ask others, some people may have looked at the boys as, not having all of their abilities because they were special needs. I actually think they are better than all of us because of the fact that they could not see the bad in anybody. They saw love and kindness and caring and not judging.
You always assume the best.
They did.
Thank you, Michelle. All right. Well, thank you all for listening, and I'll turn it back over to Anne.
Thank you both, Maggie, for about a bright light of her journey. I feel like both of you are bright lights for everyone who is joining our journey today at this virtual summit, to really be able to listen and learn to your about your experiences has been truly amazing, and we're very grateful to both of you. And I just want to end by saying, when Dr. Dean spoke earlier about the power of the personal story of mass violence survivors as being truly foundational to everything that our center does, I feel now that Maggie and Michelle gave you an idea about why this is true, and why the voices of survivors are a driving force behind the collective efforts of everyone who works in this field, everyone at this summit today. So thank you both so much for sharing your lived experiences with us. And we will be back in a few minutes with our session about mass violence preparedness. Well, I'm very excited to introduce the fundamentals of mass violence. And this afternoon, we are starting with mass violence preparedness, importance, and lessons learned. I'm very pleased to introduce my friend and colleague, who's going to be your moderator today, Dr. Angela Moreland, who is our center's Associate Director and also our Director of Improving Community Preparedness. Welcome, Angie.
Thank you so much, Anne. I'm so happy to have all of you here today and very excited to talk about preparedness. This is an area that often is not thought about when we think about mass violence and what happens after a mass violence incident occurs. We often tend to forget or don't always include into the equation the importance of what can be done ahead of time, not necessarily to prevent mass violence, but more to prepare for such an event if or when it were to occur in your community. So first, I'm going to introduce my panelists here today. I feel just so honored that we have such great panelists. You'll hear, once you hear their expertise and their experience in the field, why we have them today, and also just why they're such close partners and such close friends to our organization, and really help us walk through the preparedness component and help communities to be able to prepare for the act of such a horrific event if it were to occur. So first, I'm going to introduce Elizabeth Cronin and allow her to introduce herself and talk about what she does.
Hi, Angie. Thanks so much. And thanks to all the other panelists on this really important subject. So I'm Elizabeth Cronin. I am the Associate Academic Program Director at the National Mass Violence Center. Prior to coming to this organization, I was the New York State Office of Victim Services Director for over a decade. And I also spent many years as a special victims prosecutor. So thank you.
Thank you, Elizabeth. And next up, we have Chief Greg Mullen.
Good afternoon, Angie, and thank you for allowing me to be part of this panel talking about this very important subject today. My name is Greg Mullen. I am currently the Associate Vice President and Chief of Police at Clemson University. Have been here for about 6 years and prior to that, I was the Chief of Police in Charleston, South Carolina for almost 11 years. And then prior to that, I spent 21 years in Virginia Beach, leaving there in 2006 as the Deputy Chief of Operations. During my career, I've been involved in a number of critical incidents, specifically the Sofa Superstore fire in Charleston in 2007 and the Mother Emanuel Church shooting in 2015. So I'm very passionate about preparation for these events and happy to be here.
Thank you so much, Chief. And next up, we have Carrie Gonzalez.
Thank you so much. It's quite an honor to be here with all of the panelists today to discuss this really important topic. I'm Carrie Gonzalez. I'm an emergency manager currently working for the Virginia Department of Emergency Management. And over the course of my career, I've held many positions in the private sector, non-government organizations, state and local government, which has really provided me with a variety of perspectives on how we prepare for, respond to, and recover from disasters. And providing help for those that are impacted by disasters is quite honestly why I chose emergency management. And for the past 10 years, I've been supporting preparedness efforts at the local, state, and regional levels to help localities prepare for family assistance operations, which will obviously be an integral part of the response to a mass violence incident. I'm co-founder and co-chair of a regional family assistance work group that focuses on developing these capabilities and brings together a vast network of subject matter expertise. And we develop plans and training and conduct exercises focused on supporting families in the aftermath of a mass casualty and mass fatality incident. And then, of course, I've certainly responded to numerous disasters over the years, but the most significant to me was supporting Virginia Beach in 2019 in the Virginia Beach municipal shooting, supporting the Family Assistance Center there. And I'm currently serving as a liaison to the National Mass Violence Center, representing the International Association of Emergency Managers.
Thank you, Carrie. And last but certainly not least, we have Vanessa Flores.
Thank you, Angie, and thank you again for the opportunity to join this group today. Vanessa Flores, Deputy Emergency Manager at the University of California in Irvine. I am a bred Air Force emergency manager, but I have been with the university system and higher education for about the last 3 years. The last 2 have been focused on developing a mass casualty incident response plan for the campus, while I recognize the gap in just higher education as a whole and the resources that are available to us when it comes to mass casualty incidents. So for this reason, a subgroup of the International Association of Emergency Managers is the University and College Caucus, or what we say UCC. So I have been chairing several working groups to develop products and resources for higher education specific to mass violence and victim response. So very excited to kind of fill that gap. I know there's plenty of resources out there for K through 12, but not so much for higher education. So happy to be here and happy to continue to bridge that gap.
Thank you so much. So just to start off, I said this a little bit at the beginning, but just to set the stage a little bit for the phases of mass violence incident assistance. As I said before, we tend to talk a lot more about the red and the yellow squares that we're talking about here. So once a mass violence incident occurs, kind of what tends to be discussed is what happens in those 1 to 4 weeks after, which is what we consider kind of that acute short-term response period, or what happens after that. So we do have question marks here because we consider that recovery or resilience stage to go from a couple months after an incident almost to forever. So what we've really learned is that it doesn't end after a few years, a few months, a few years. It can take a very long time for a community and forever for a community to completely heal from an incident. But as I said before, the planning and the preparedness is very, very key to what happens in that response and recovery resilience boxes. So there is no possible way that we can be completely prepared, no matter how much we do. I think I probably could call on Vanessa and Carrie to talk about this specifically. No matter how much as an emergency manager, no matter how much planning you do day in and day out, it's going to be chaos if an event occurs and when an event occurs. That being said, there are a lot of things that we can do ahead of time to, number one, help victims in that immediate and long-term response. So to help set them up for success, help set people up for success as they move forward, and really just have things laid in place so that that chaos, you can control the pieces of that chaos that can be controllable. So my experts that are on the panel today will talk some about that and really talk about what their lessons learned are, what they've learned both in their roles and in working with communities and individuals, and also in their response. So some of them, many of them have responded to incidents in general, and some of them specific mass violence incidents. So We're going to talk a lot about preparedness and really have some of those take-home messages. As the Preparedness Division of the Mass Violence Center, we really base what we do on 16 best practices, and these were initially developed by ICF, one of our organizations that has worked on preparedness for several years, getting ready for mass violence. And these best practices, this doesn't encompass everything that will happen, and it certainly doesn't encompass everything that you can do to prepare. Even if you're perfect in all 16 of these, like I said, there will be unknowns that come up. However, what we've really found is that if individuals and communities can really focus on how to best prepare in these 16 different areas, they will be setting the stage for success if an incident does occur. So rather than going through all of these 16 best practices today, we have entire presentations and literally entire couple-day workshops where we go through all of these best practices. And I encourage you, we'll give our information at the end to reach out if you're interested in learning more about these. What I thought might be our best use of our time today is really just to hear from our panelists and hear from our experts. So we'll be touching on a lot of these best practices and really talking about how they have come forward and how they've really played out in their everyday worlds and in their fields that they've worked in. So I'm going to go through several questions and call on some of our panelists today to talk about some of the experience that they've had and really let these best practices come to life kind of through those particular questions. So our first question is a very, very broad one. So I want to know just very generally, why is preparedness for a mass violence incident important? I've used the term if and when. We like to say, what can you do to prepare for when an incident happens? We could say if, but I think it's best to just assume it will. And then if it doesn't happen, you already have the skills, you have the toolbox, and those can be used for a lot of other areas in the disaster realm in your communities. So just to start us off, I'm going to call on Elizabeth first to answer, why is preparedness for mass violence important in your opinion?
Thanks so much, Angie. So in my former role as director of the New York State Office of Victim Services, I was able to be on both sides of this because we both had to plan for these incidents and we had to respond to these incidents. And as you can imagine, in New York State, we had a number of mass violence incidents that we had to be responding to. And what we found was they were all entirely different. And so, one of the things that you have to consider when you're doing a plan is that you're never going to walk into the same room twice. And it's always going to be different demographically, geographically, resource-wise, preparedness. You are never going to know exactly how to respond to every particular incident, but that being prepared is going to give you a level of reassurance that you will be able to pivot, which you're going to have to do every time we did, and be able to respond to things as they are developing. And, in a state like New York, like a lot of other states, we are extremely varied in demographics and in geographics. And so you have to really think very broadly in your preparation about, if I don't have, so for example, in upstate New York, there might have been less victim assistance programs that were funded through our organization. Is if there's an incident there, what are the victim service resources? And if they aren't very full, then how are we going to get other resources to that area? When you are prepared, Angie, you mentioned the word chaos, which is exactly what you walk into, no matter how well prepared you are. But if you are prepared, it ensures that you are going to feel somewhat in control. And when you have all of the partners and the players that will be relevant in a response, and you sort of have a blueprint for how you're going to move forward, and who you need to contact, who are your allies, who are you going to be able to call on, then your response is going to be much, much more organized, and you will have a lot less stress as a result.
Thank you, Elizabeth. Chief Mullen, I would love to hear from you about this.
Thank you. I am, because Elizabeth covered a lot of the specific things that are different, I'm going to talk about some things I think are really important in terms of how you exercise that preparedness. Obviously, these are novel events. People don't have a lot of experience with them, but the things that you can do in my experience in my career to help you be better prepared is, one, is you utilize those plans that you execute during your daily operations. Those are ways to get those things, your staff and those people around you and your partners to understand what you're going to do when you actually have an event of this scope and magnitude. It helps you to create that order out of chaos, and I think it's a critical point of what we want to accomplish. We also use pre-planned events. I know my emergency management friends love to create IEPs and different things for massive events that include multiple agencies. That allows you to practice those things like incident command, understand the capabilities and the what people bring to the table, which are critically important, and fill some gaps. And then I think the final thing I would say that's really important about the preparedness is to create these alliances that bring to bear that resource that you need, that you are not used to providing as a single agency. So when you're doing your family and friend center or family assistance center, who from your community is going to come in and fill that gap for mental health victim services? And to have those relationships and that confidence already built prior to that event allows you to operate much more effectively. And what that allows you to do is bring your people, organizations, and systems together and leverage those skill sets and that they bring to you so that you can help your communities get through this in a more orderly way, which brings some calm to the chaos. And it helps you to create an environment that allows your community to begin to not only address the human issues that occur in the mass violence incident, but also the operational needs that require different items and resources for the actual response.
Thank you, Chief. Those are really, really great points. I would love to call on Carrie next to talk about kind of from the emergency management perspective. You're coming from a little bit of a different lens in the situation.
Yeah, thank you. I agree wholeheartedly with everything that's been said previously. I think especially the piece about exercising, super important to make sure that people are comfortable with what they are, what their roles and responsibilities are. And in emergency management, we often refer to a quote that's often credited to Benjamin Franklin that says, "By failing to prepare, you're preparing to fail." And so, what that means for us is one of the core functions of emergency management is preparedness. We prepare individuals, organizations, whole communities for emergencies and disasters. And what we know from that process is that through planning, through preparedness, it helps in many ways, which includes, establishing a common understanding of processes, building those relationships that have been mentioned, identifying capabilities and resources that are necessary that your community may not have. Defining those roles and responsibilities, and then just as important, fostering buy-in and commitment to the effort. And so, this question's an important one because this is really where we start. When we start planning and preparing for any type of incident, we often are asked, why should we do this? And so all of these points, I think, just further the conversation about bringing the right people together to do the preparedness actions. But specifically for mass violence incidents, it's important because obviously an incident of this type has far-reaching impacts on the individuals and communities. And the way that we respond to the incident will also have an impact. And so it's inherent upon us to prepare now, to enhance our capabilities so that we have a more positive outcome. During a response, we obviously need to prioritize the needs of victims and survivors. That's critical to individual and community recovery. So that makes it imperative that we actually invest now before the incident happens. We need to engage in the preparedness activities to identify how we're going to be able to support victims, survivors, and families in the aftermath before it happens.
Thank you so much, Carrie. And I'm actually going to go to the next question and combine them for Vanessa's because I think I kind of know what her answer is going to be because I know her expertise in this area. And I think it would be great to hear both keep that first question in mind about why preparedness is important, but also just really how that differs from other disasters. So as an emergency manager, Vanessa, you talk about needing to be prepared and really going off of that same quote that Carrie just said, but you're preparing for a lot of different things. So I would love to hear why preparedness is important in light of, like, specifically to mass violence, in addition to all the other disasters that can happen in a community.
Absolutely. Thanks, Angie. So to kind of piggyback off everybody else, yes to everything that everybody has said. But when it comes specific to mass casualty incidents versus the natural disaster, I think we find the difference between, planning for something that's a little bit more predictable for natural disasters, right? We kind of have some lead time into what's about to happen versus mass casualty incidents where we don't. And it could be anywhere, McDonald's, churches, any location. So it's really hard to plan for that. So the predictability aspect of it, and then understanding all the moving parts. So when we talk about emergency managers, we plan for the 80-20 rule. If we can plan for 80% of it, then we're only having to deal with the 20% of the unknown during the emergency. That is very difficult to do when we're talking about the mass casualty or mass violence incidents, because it is victim based, right? It's situational dependent on what their needs are. Whereas natural disasters, we can assume that it's going to be focused on, search and rescue, evacuations, sheltering, that type of event, where mass casualty can be very incident. There's a very broad range of resources that may be needed based off those individual needs. So you really have to understand in your community who's there to kind of fill those gaps, who's there to supplement you as an organization for psychological support, for all types of incidents. So being able to really get a grasp on what your resources are so that you know who to call on when is needed during that incident is huge. So I think it's very different, and understanding there's a lot more components involved than it would be just for a natural disasters. Everything from, public communication is a different aspect. That's a sensitive and controlled public communication, whereas you're looking at natural disasters, it's more timely, it's more widespread. The long term is more focused on psychological support versus the long term is for natural disasters is more about rebuilding and structuring. There's a lot of different components. So being able to kind of understand and try and plan for that 80% is difficult, but is crucial to be able to kind of get to that point when preparing.
Wonderful. You summarized that so well. Thank you, Vanessa. So we're going to move on to the next question about, and I think some additional answers about other disasters may play into this one as well. So I put up the 16 best practices. We're not going to go over all of them, like I said, but instead what I would like to hear is from each of our panelists. I'll call on you about which of those or things that maybe aren't included in those best practices are the most important components. So if a person's listening today and they say, I can't do it all right now, but what's something I really need to focus on? Like, what's the priority right now? What would you say? So I'm going to flip it up a little and have Chief Mullen, if you feel comfortable, going first.
Absolutely. So I think there's really two components that I would say are most important. And one is operating under that mindset that you mentioned earlier, that this could happen in any community, any town, any city. And as you think about that, I think you have to be driven in your commitment to assess what your current capabilities are, identify the gaps, and then build capacity that allows you to address both, as I said earlier, the human issues as well as the operational issues of the incident itself. And that can incorporate really using after action reviews of your peers to make sure that you see what the themes are in terms of what the strengths are that have occurred in these incidents and what are some struggle areas, so that you can build your capacities around that, and also conduct those multi-agency exercises that demonstrate your capabilities and go beyond just the response. So many times people stop at the response and they don't follow through with the Family and Friends Center, the Family Assistance Center, or all the things that happen after that initial response. Then the second thing I would say that I believe are really important is to utilize those daily operations to build your confidence, the trust, and the respect with your mutual aid partners. Do everything that you can possibly do. Understand incident command. A lot of people talk about using incident command, but they don't really use it in a way that provides the confidence and competencies that are going to be required in a mass violence incident.
Thank you, Chief. Those are great. Vanessa, I'm going to call on you next about what do you think is most important from where you stand in the field?
So I agree with what Greg said, but just recently I developed a family assistance center exercise, first one that we've ever hosted for the university. And I think one of the important aspects of that was understanding that the folks that we're assigning to this team to respond are not emergency managers. This is a whole separate world that we live in, and we are trying to integrate them into this world and having them understand what this means to be a response as part of a response team. There was a big gap in between that. So having to kind of bring them up to speed as far as that goes, and then having to talk specific to, what this means for a mass casualty incident, how this operation works, trying to get them to understand what we call as ICS, the incident command structure, and how that kind of plays out. For us, it's second nature. For them, it's not. So, having to get them brought up to speed on that was a big difficulty for me. So just kind of keeping that in mind, understanding not everybody's living in this world. So bringing them to where they need to be so that they understand what that response component is going to be. And then to Greg's point, making sure that you guys train together with the people that are going to be coming to respond and help support in those operations, to be familiar with those folks, to understand the capabilities and the team and how that integrates is really important.
Thank you. Carrie, what are your thoughts to add to that?
Yeah, I think those are all really important points. And I would just piggyback on the, and point out the importance. We sometimes we get so focused on developing a plan or an exercise, and we kind of lose sight of why we're doing it. And we're so focused on maybe perfecting it or making sure that we get everything right. And that's not really the point of it. We are going to make mistakes. We're human. And so bringing together, that's the most important piece, as Vanessa said, bringing everybody together to get to learn about each other, to know each other. It's really about connecting and understanding roles and responsibilities. And then, someone mentioned it earlier, but building the confidence in the abilities. But on the flip side of that, it's just as equally important throughout all of this to sort of, identify the gaps. Where did we fail? Where did we not do well? And that's an important piece of the process that we often overlook and sort of shy away from because it's hard. To admit failure or gaps. And so that's an important part of the process as well, is just understanding where we need to continue to build and grow and plan towards, develop course of action, and work together towards that common goal. So that's an important aspect of it as well. So not getting so lost in all of the specifics of a plan or an exercise, but really just coming together and have those conversations. And it's okay to identify the gaps. It will help us know where we need to focus future conversations.
Wonderful. Thank you, Carrie. And I'm actually going to do the same thing I did before and flip to the next slide for Elizabeth, because I think it will probably play into it because I know her very well. And when we talk about the important components, victim services is one key piece that we often don't talk about or that we don't incorporate into those plans. And as a couple of my panelists already said before, not just right after, but the victim services for a long period of time. So Elizabeth, I would love to hear your most important component, but I have a feeling it has to do with this question.
Yes, indeed. Thank you very much. I don't know that it's second nature for a lot of emergency managers to think about victim services. And in the end, they're looking at how are we going to get this disaster to kind of abate. But the problem is that the ramifications for the victims and survivors will go on for weeks, months, years, long after the incident is over. And if you don't include victim services from before anything happens, then your planning is really very incomplete. And, communities suffer. It's not just the individuals and their families, but whole communities suffer when there is a mass violence incident. And so it's critical to include this part of the puzzle when you are organizing and planning for response to a mass violence event, and to really think through what does that mean? Like, who are we talking about? I mean, one of the things I saw in Lewiston, Maine, was that one victim said, yeah, she got mental health services, but it was clear to her that the therapist was not trauma trained. And she said, and so it ended up not being right for her. So it's not just knowing, yeah, we have some of these resources. It's what resources do you have that can respond to an event of this magnitude? So it's thinking, I think, beyond kind of what we normally think about when we're talking trauma, and thinking more broadly about how this is going to impact the whole community, including first responders.
Wonderful. Thank you, Elizabeth. So I'm going to go ahead and wrap up with the last question. We've already heard a lot of key takeaways from people. So I'm actually going to summarize a couple of those takeaways that we had and then see if anyone wants to add anything. So really in talking about those principal components, many of the things that we heard were to prepare and plan for it to happen. So expect that it will happen. And have that be part of your everyday language. So have it be a part of your exercises, have it be built into the plans, and really built into those plans specific to where your community is. So for instance, Vanessa is at a university. So she talked about really thinking about how that would play into what's happening at the university, what's happening, who are the students that are there, who are the faculty, what is the, what's the landscape of where that sits. Also, as Chief said, really having that be a part of your everyday exercises. So having it be what you're doing on a daily basis, not having this plan and this preparedness. What would we do in a mass violence incident? And we're going to put it in a binder and put it away. And we won't do any of those exercises or even talk about those things until it happens. Instead, have it really be a part of it. Carrie mentioned and others kind of talked about as well, just the importance of really having those connections and having it be where, as you're making those plans, thinking about all the different components and having those partnerships and connections together. And I'm going to add, which everyone touched on this, but the exact word of trust hasn't come out specifically. I'm going to add just the importance of building those relationships and knowing people ahead of time. So not only through those exercises, I mean, that's insinuated through the exercises and through the plans and the committees, but on that night, and this is very, we've had this experience both in Charleston with Mother Emanuel, but also in multiple incidences that on that night, which is your community's worst night, if not, one of the worst, if not the worst nights ever, to be able to look at someone who's at an organization or in a role or a first responder who you already trust and you already know their name and you already feel like you've done those pieces together goes a really, really long way. So taking all of these components that our experts have said today and really thinking, how can we build all of this in and start building that trust and start building those relationships very early on, and do that now. So yesterday, basically, so that you're already having that and you already have that laid out. A couple of pieces that we have. So on our next slide, we talk about a few things that we can provide through the National Mass Violence Center. We have our division of preparedness that we've just been talking about. I like to say we do everything from A to Z as far as really working specifically on particular asks. So sometimes a community will come in and say, we really feel like we have it down. We have our plan, but we need help with this. We really need help with communications, or we don't know where our family assistance center would go. So one tiny thing all the way up to partnering with an organization or with a community and walking through A to Z, all the steps of what can you do in that plan and how can you start building this up now. So please reach out if you're interested in any of those. All of the people that you've seen on our call today are our partners and our consultants. So they could certainly be a part of that plan. And then we also have a lot of other experts in the field who unfortunately are part of this club or part of this expert pool because they've been through this. They've walked the walk. They've learned sometimes the very hard way of what are ways that they did a great job in preparing and they were ready, or maybe have some lessons learned and some suggestions for the future, what they could do or what other communities could do. So here's our information right here. I'm going to wrap up by just really thanking our panelists, our experts today, my friends today, and just say we're so happy that you're here and hearing your story and where your experience and your lessons learned is really what's needed in the field. So thank you.
Our preparedness panel has reminded us that our emergency response plans need to be practiced, that building connection with allies early also builds trust, and that victim survivor services are a critical component of preparedness. Finally, if the community is prepared, it may help the community's response to mass violence, which is actually the topic of this next panel, be rapid, organized, and cohesive. So this session is going to discuss some of what goes into the initial Family and Friends Center and the later Family Assistance Center, and best practices for communities to begin a collaborative response. I'm pleased to introduce our two panelists for today. First, we have Krista Flanagan, who is the director of the Institute for Crime Victim Research and Policy at Florida State University, who is an attorney and advocate experienced in emergency response, management, and very much more. And next is Roger Roberts, who serves as the director of Crisis Response Services for the National Organization for Victim Assistance. Roger has responded as well as coordinated team deployments to various traumatic events, including the October 1st, 2017 Las Vegas mass shooting and the Robb Elementary School shooting in June of 2022. So in the immediate aftermath of a mass violence incident, it's extremely scary and very chaotic. People are desperately trying to locate or find information about the safety of loved ones who may have been at or near the site of the incident. People want to know not only their loved ones' whereabouts and welfare, but also information about the incident and available resources. So Krista, I'm going to turn it over to you. What are the initial strategies for a response?
Thank you so much, Kevin. Before we talk about that, I would just like to talk a little bit about language, because as the field of victim services evolves, that our language is going to change too, particularly related to services. So when we're speaking now about what we're calling here, for our purposes, the Family and Friends Center, it has formerly been known, and still in some circles, especially education circles, been referred to as a reunification center. We are trying to get away from that language, because what we have learned from victims and survivors is that that is not necessarily the most accurate language, and it kind of sets up maybe some false expectations. So for example, so Kevin, as you said, that people come to the scene once they hear that an incident has occurred because they're trying to locate their loved ones. They are afraid, it's chaotic, it's they're traumatized themselves and they're wanting information. And so when they are asking where they can go to get that information, and someone says, go to this building, which is the reunification center, what people are hearing is reunification, and they believe that they're going to be reunited with their loved ones, when the reality is maybe they will not be, maybe they'll be receiving a death notification. So the language that we are changing over to is maybe Family and Friends Center, or maybe an information notification center. It's avoiding that reunification term. So as you stated that, people rush to a scene, they want to know where their loved ones are. So this is a location that is set up fairly spontaneously. And this is done usually with the incident commander and the, hopefully in coordination with the emergency manager as well, to try to find a safe and secure location that is preferably out of the sight and sound of the incident, that is not in kind of like that zone of safety or investigation where law enforcement is trying to secure a scene. It should be a location, though, that is accessible for transportation, that it's accessible for abilities, and that is also safe. And what we look at as far as who can access this particular facility is usually the people that come to scene are family and friends looking for people that are missing. Maybe they cannot locate their loved ones, and what they're trying to do is get access. And it's important that information be collected by people that are coming on scene, as far as name, contact information, and really starting that database initially. And who we see at this particular center, you're going to see law enforcement because it's important to have that contact with law enforcement that will be able to provide that accurate information related to the investigation, et cetera, the location of the suspect, making sure that, again, looking at primarily with safety, but also having victim services there, maybe some mental health providers to provide that information and resource support. And then as we move on to the next slide, that what occurs at this location is that it's a place for families and friends to really convene so that they can get that information about where are their loved ones, which they might be in a hospital. They might have tracked them and maybe they're at home. Maybe they are still unaccounted for, but to have an official location for that. Also, it is the official location for the status of the investigation and also the rescue and recovery efforts. And as I mentioned before, that this might also be where death notifications take place if there are those that are deceased as a result of the incident. Now, this poses some challenges, as you can imagine. That death notifications, as we know, are not simple to do there's not really a good way to do them in any type of incident. These are one of the most difficult responsibilities that we have as providers. However, we know that in these environments too, that oftentimes as people are being reunited with their loved ones and leaving, that those that are left at the information notification family and friends center are usually there waiting death notifications. That's okay. That, they still want to have that connection to be able to get the official information. So having a location where there can be private notifications that are given, they should not be obviously given as a group. Also, that the privacy piece is important so that there aren't any windows where people can look in, and if they are, that they are covered so that people can feel safe and have the private time to grieve and mourn, especially in those early moments of that notification. Now, where these are located are going to be, as I said, determined by incident command and emergency manager. They may be at a hotel. They might be at a church. If there's, there might be at a gymnasium of a school. They might be at a convention center. Again, looking at being out of the sight and sound of the incident. These are usually opened within a couple of hours of the incident, if not before, and typically don't stay open any longer than about 72 hours. That's usually at the high end. Usually it's between 24 and 48 hours, and then it transitions into a family assistance center. Sometimes, which Roger's going to talk about, but sometimes what we'll see related to location is that this particular center may end up transitioning into the Family Assistance Center. It really depends on logistics. How long is this facility available? Because this has to be open so quickly, it might have to be open for business in a couple of days, and so they can't allow the facility to be available for any longer than that. If it is available for a longer period of time, it may just transition into the Family Assistance Center, which Roger will talk about now.
Wow, great. Thank you very much, Krista. And absolutely to kind of continue on with that point, those transition pieces that, again, this Family Assistance Center that we are in now, or talking about now, can usually, it transitions probably into that within the first, I would say 24 to 48 hours from the initial incident. And a Family Assistance Center can then operate for, several weeks or up to a month. And then it may transition again into a resiliency center or another center similar to that. Again, a lot of this is determined by the size and the scope of the incident that is taking place and the facilities that are available within the area. A majority of these are determined in the plans that are set up by local agencies. So whether that be a local emergency management or local law enforcement as they start to look at and determine those facilities. But obviously, they're going to want to have a facility that is secure, that is accessible, as Krista mentioned. And some of those things that I would hope for communities to think about are facilities that are accessible for folks that don't turn folks away. Oftentimes, people will set them up within churches and/or government agencies, and sometimes people find that to be a limiting access for them, so they would not want to, or maybe don't usually seek out services within those agencies. Completely understandable in certain communities that might be the only thing that is available. And again, depending on the size and the scope, we might need to have a large facility. So a family assistance center, however, really serves as that centralized point for information and notifications, continuing on what has started with the Friends Center, and being able to be that one-stop shop, in my opinion, for folks to be able to go to that one place, a point of contact to get information and some other services or resources provided to them. It is also the place where a lot of the personal property is returned to victors and survivors or families, and that is usually done by law enforcement. So making sure when you're looking at or considering a facility similar to those, that you have an area that is private, where information for resources or items to be stored, and for those items to be given back to folks within a safe or private area. And it also really, like I said before, that one-stop shop, just that ability to make sure that they have a wide range of services and coordinated, to begin that coordinated case planning. And as you'll see on the next slide, and within the family assistance centers, is really about the professionals that are there to operate or to help, with the day-to-day operations of the family assistance center. A lot of those folks can be victim services folks, Red Cross personnel, volunteers, behavioral and mental health folks. Our crisis response team through NOVA like to fill this role as well. We call our folks who come in to help in a family assistance centers companions. Red Cross has calls theirs navigators, and it makes sense. These folks are there to help individuals, survivors, or victims as they come into a family assistance center to navigate the space that they're going to be in, to connect with them, and to get the help and the assistance that they need. So when an individual comes into a family assistance center, they're greeted, they do an intake, and then they're passed off to either a companion or a navigator to help them navigate the services that are available. And so what we would do is sit down, talk to the victim or the survivor as they're telling us their story and what it is that they've experienced. We identify those needs, those immediate needs that they may have, so that we can help to connect those with the resources that we have available within the Family Assistance Center. So definitely taking into account those basic and personal the personal needs that they may have: food, shelter, clothing, warmth, transportation, any child care related issues. We also like to provide in family assistance centers a safe space for kids to be there. So looking at when families are bringing children into the family assistance center, identifying volunteers who can specifically or have the background checks to work with and to handle those young folks while the parents are taking care of paperwork. Again, property return, beginning to help them to identify those behavioral needs that they may have, and helping to get them into some long-term recovery pieces. It's definitely a space for their legal needs, their spiritual needs, you name the resources. They are usually available within family assistance centers, or could be, and those are usually identified or can change over time based off of the needs of the victims or the survivors as they're coming in to those. So it does provide a wide range of services, and it does continue to provide referrals out to those information or those pieces within the community.
Roger and Krista, I just want to thank you very much for all that. It's a lot of information. I guess just listening to it all as a first-time listener, I guess one of the questions I would have is, what happens, what's it like for a person coming to either the Family and Friends Center or the Family Assistance Center and saying that they're a victim? How do you know that they're a victim? Is the center open 24 hours? What's the experience like in terms of just showing up at the door?
I'll start since it's the first centers where people go more immediately. That initial center, the information center, the family and friends center, that it's very chaotic because the scene is unfolding. The investigation may be going on, the suspect might not be apprehended. So really looking at trying to verification of victim, or even how we identify, isn't as stringent maybe as we move along, because sometimes too we see even the access to resources and how we define victim does evolve over time too, and over the course of a response. So at this initial center, what we see is if people come in and they are able to say they're looking for their loved one, their child, let's say, and a couple of questions might be asked, and they might have to show some identification, and that would be all just to get that basic information. And I just wanted to clarify too, because what Roger was talking about with the Family Assistance Center, what we call an FAC, is that has a lot of resources under one roof. With this first center, oftentimes it's more access to resources to let people know where the resources are, because this stands up immediately. The idea is to really give people information, and then to provide them information about where their loved ones are, and notification, if it's a death notification, or notification as to where their loved ones may be. And it changes a little bit then when you go to the FAC. Roger?
Yeah, and again, absolutely, I agree completely, Krista. And I would just say that definition of victim does change over time, but that definition is important, because based off of that definition, it really lets those folks that are operating within the family assistance centers that are providing services under assistance to know who is really the ones eligible for receiving those services.
That's very helpful. I'm also thinking about, we can't tell when these incidents are going to happen. Is the centers, are they open 24 hours? And also, how long can I stay as a victim family member? How long can I be there to find out if I haven't heard where my loved one or my person is? What's the process there?
This first center, oftentimes they are open 24 hours because you're waiting to get death notifications. And depending on the number of fatalities, this can take maybe 12, 14, sometimes even if you're looking at something that is a large scope, even 24 hours. And so people don't want to leave. And so the center services will be available until, an FAC can open. So yes, it could be open for 24 hours. When you transition into an FAC, that might shift a little bit. So Roger, I don't know if you want to talk a little bit about that.
Well, sure. Yeah, so when they transition to a family assistance center, they usually start off with set hours, usually longer, trying to do their best to accommodate those individuals who may still be working. So looking at starting early in the day and continuing into 7, 8 o'clock, 9 o'clock at night. Those hours then change as they go, as the demand starts to decrease. As we start to see fewer community members come into family assistance centers, we'll start to reduce those hours. And I would say a majority of family assistance centers do operate 7 days a week in the very beginning, and then we'll slowly also begin to transition to there. So they may start to close on a Sunday, or then they might close for the weekend and only operate during the week as they get closer to a net transition to a resiliency center or whatever may come next.
And I just want to add something onto that, because I think what you said, Roger, is really important about, especially initially with the 7 days, because sometimes these incidents happen over a holiday or close to a holiday. And it's important that services be available during that time, and that, trauma doesn't take a break, right? Trauma doesn't take a holiday. So it's important that even, if it's a federal or state holiday, religious holiday, that there still be resources available, because at that time too is when people might be even feeling more emotionally vulnerable and need access to services. And as Roger said, that as time goes on, you could be looking at maybe limiting the hours as it's going to be transitioning into longer term services. But in those initial days, that 7 day a week, longer hours is really important, so that people can have access to the services.
That makes a lot of sense. The other question I think people have is, in some of the incidents, well, one of the things happened at the Navy Yard shooting was there was a lot of false reports about different people and different entities involved. And I'm just wondering, what do these centers do to promote active information that is accurate?
Roger, you want
Sure, I was going to let you go first. Of course, yeah, I think that one of the best things that can happen within a family assistance center is making sure that we provide and have the most current and up-to-date information on those incidents, as well as we can start to see or identify any rumors that might be starting, and then be able to work with the authorities to help to address those or to take care of those. So you're absolutely right. There has a tendency to be a lot of misinformation in the very beginning with all of that chaos, and it doesn't always end just because we're moving farther away from the incident.
And by the time that a family assistance center opens up to that, law enforcement is starting to collect lists of people that were on scene, and depending on if it's a closed location, that those kind of lists are being generated, so it is easier to verify. With that initial center, though, as we said, there's just really no way to do that. And because really what you're seeing there are people that are looking for their missing loved ones. Maybe it's those that were present but not injured, or their family and friends as well. And it's just really collecting their information and asking for ID and maybe a couple of questions as to try to pinpoint that they're not being fraudulent. And really in those early hours, we see less of that. It's the farther away we get from the incident, the more likely that it is for fraud to occur.
I guess in terms of the timing, how long did this Family Assistance Center, Roger, how long would it be in operation, and why would it eventually close down or transition?
Yeah, that's a great question, Kevin. I would say that, a majority of family assistance centers, I would say are open for probably 3 to 5 weeks, maybe, a month, a little bit more. But they do transition. And as Krista was saying, the longer they stay open, the longer we see other issues developing from the community, in the sense of folks coming in that may not need direct services, or coming in because they heard that services were being provided. And so they just kind of see it, like I said before, as a one-stop shop. They show up because they were told that they were counselors and they need a counselor, but they may not be directly impacted by the incident that actually opened the Family Assistance Center. And then they do, as they move on into some more long-term care pieces, that's where they transition into the resiliency centers, where they're really looking at the long-term care for the community as a whole.
And sometimes when we're looking at, like when Roger's talking about that, from the 3 to 5 weeks, that it already is starting to transition into that a lot of the providers at the family assistance centers are starting to go back to their offices, or, their programs, and people are being maybe referred out, or that warm handoff, and that it's more that navigation. So they're starting to begin that resiliency center kind of model there, but not quite officially yet.
You mentioned staffing and collaboration, and I'm just curious about how is this paid for? I mean, it sounds like the staff is immense, and it's professional. There's behavioral health, there's victim services, there's law enforcement. So what can communities look at in terms of the expense of this?
I think for the first center, really oftentimes it's in-kind donations that people are coming to help. What's recommended, though, is that they are identified prior to and that they're deployed. We know that people will just show up. And so it's important, that's part of this planning piece that Roger had mentioned, to be able to implement a plan where people have been, advocates, counselors, et cetera, have already been identified, vetted, and trained to provide these resources, and they would be deployed to staff this particular center. The same thing with an FAC too. That's where we start to see where maybe there might be some costs that would be involved, and there are some federal funds through Office of Victims of Crime, primary one being AEAP, which is the Anti-Terrorism and Emergency Assistance Program. It's reimbursement, but it can help pay for any overtime costs, or even any facility costs too that are not being donated. Also, sometimes some local state funds will make themselves available to pay for these services.
Thank you very much.
Really quick, I just have to tell you that we never have seen a community not set one up worrying about money.
Right.
That usually happens after the fact, but it's great if we can plan it ahead of time, but it'll happen.
I'm sorry to do this, but this contribution has been incredible. We have 2 minutes left, so I want to give you each a minute. Any last words or lessons learned or advice you would have for either the community or responders?
Oh, so many. So many, so many. Well, first of all, you know, as you started with this, Kevin, is that the response can be overwhelming. And when people start to think about this and do planning, that it can be really overwhelming. But the reality is that, like what Roger said, communities do come together, but there's no reason for them to start from scratch because this has been done before. There are so many lessons learned. And that's what part of this planning process can be, is to learn from what others have done while a community is not in crisis. And also to know, for communities to know that you're not alone, that, you know, you don't have to provide this by yourself, that there are lots of resources out there. Roger talked about Nova, and there are others, and just knowing who it is that you can call on and that you can get training ahead of time so that you can be prepared.
Roger.
Kevin, thank you guys, everyone, for their input. I would tell you my two pieces. One would be that, like Krista said, that early training and education. So that's what NOVA provides for communities so that they can start to help to put together their local response teams. And then the second piece of that is that the family assistance centers and the family, centers are there to take care of folks in the community, but at the same time, it can be very taxing on those workers that are coming in. And so I'm always a proponent of, in that planning, that we make sure that we set aside something and that we are making sure that we're taking care of those people that are taking care of people. It's important. It is a marathon. It is not a sprint for all of these centers. And so we really need to be able to sustain ourselves, and taking care of ourselves is how we do that.
Thank you both very much. Appreciate it.
Thank you.
We just learned from the previous session that the response to a mass violence incident is a collaborative effort that's flexible in meeting both immediate and evolving needs of the victims, their families and loved ones, and the impacted community. And we also learned that the initial established response centers are time limited, bringing us to this session where we will learn about the ongoing recovery and resiliency efforts, fundamentals of recovery and resiliency. And it's my pleasure to introduce our moderator of this session, my colleague, Dr. Alyssa Reingold, who is the director of our center's Response, Recovery, and Resilience Division. We have two fabulous panelists today, Alberto Beto Ruiz, who is the senior director of the Community Resiliency at the United Way of El Paso County in Texas, which oversees their resiliency center, and Maggie Feinstein, who is director of the 1027 Healing Partnership Resiliency Center in Pittsburgh, and also the amazing and wonderful hostess of our on-site summit this year. Welcome to Alyssa and the panelists.
Thank you so much, Anne. So welcome everybody. I know we have a brief time together just to kind of talk a little bit about recovery and resiliency principles. And before we hear from some of our expert panelists, I just wanted to kind of organize a little bit to help everybody understand some concepts at the start as we kind of open up and discuss some of those. So today we're going to talk just real briefly in understanding what resiliency and recovery looks like after mass violence, and talk a little bit about the Resiliency Center model to support communities after mass violence. And then we'll hear about some lessons learned from both Maggie and Alberto about effective strategies for long-term recovery and resilience. But to start us off, I just wanted to highlight so that everybody understands what a resiliency center is. A resiliency center is really a sort of central hub or framework for long-term recovery for victims, survivors, family members, first responders in the community that were impacted by a mass violence incident. It's really a partnership of people and organizations that work together to offer connection, services, and support. So it's not really one entity or one person, it's really a collection of community partnership that really make up a resiliency center. You can go to the next slide. And so just to kind of give context a little bit about history of resiliency centers. So really the Resiliency Center ideas started actually in the 2000s from some lessons learned related to victim services in the aftermath of a number of different mass violence incidents. But it really didn't get formalized and developed in sort of some initial models until around 2012, 2013, when the Department of Justice Office of Victims of Crime started to develop more formal models. The very first Resiliency Center models occurred in Aurora, the Aurora Strong Resiliency Center in 2013 in response to a mass violence incident in a movie theater. Around that same time, the Resiliency Center of Newtown was established in response to a school shooting in Sandy Hook. Then shortly after the Boston Marathon bombing was the Massachusetts Resiliency Center, established in 2014. And then in 2015, the Charleston Mother Emanuel Empowerment Center was established after a hate-based mass violence incident that occurred in a church setting. Since those initial centers were developed, as recently, there has been over 25 resiliency centers that have been established across the country. So it's a pretty newer concept over the past decade of a formal center established. And now, unfortunately, because we have over 24 centers, we've got a lot of lessons learned. Resiliency Center scope of services include a wide variety of types of services, and this doesn't even touch upon everything, but typically resiliency centers offer victim survivor navigation and advocacy to connect people to resources in the community and victim advocacy support, financial assistance and counseling support, legal consultation and referral services, evidence-based behavioral mental health services, as well as just general counseling, clinical services, broader resiliency and well-being strategies. Not everybody might need formal trauma-focused treatment, but some people might need connection and support and well-being. Fellowship peer support program is really important. We know peer support's a buffer and can offer support to those impacted by trauma. For those that experience court proceedings, the resiliency centers can be very instrumental in providing that court proceeding support in collaboration with victim advocates in the justice system, and then first responder specific services. So this just touches upon some of the scope of services that resiliency centers typically offer. But I would like to actually just now take pause and just open it up. And I want to hear a little bit from Maggie and Alberto. And we're going to take a step back from just resiliency centers and maybe talk first about what recovery and resilience sort of looks like after mass violence. So I'm not sure who wants to kind of start, but just from your perspective, how would you define resilience and recovery? How about I'll start it off with Alberto.
Thank you, Elisa. I think if I had to describe it in one word, right after a mass violence incident happens, recovery is gonna be messy. We need to be prepared. No matter how much we prepare ourselves, how much we plan, things are likely to be convoluted when we first start, and that is fine. That is perfectly fine. So we need to understand that there's gonna be a learning curve. And it's going to be labor intensive. There's going to be an exercise on educating the community, determining what their needs are and how they would like to have those needs addressed. And it is an ever-going like self-actualization process. You need to be dedicated. You need to have patience. You need to have ingenuity, because addressing the needs of a community that has never been exposed to such a tragic event, it's going to come with a learning curve, and we need to be flexible to serve the community the way they deserve to be served.
Yeah, thank you, Alberto. I agree with all of those things. I like ingenuity, especially. The one I think, recovery is a little bit more practical. We can think about kind of those practical needs of the individuals, but then, resilience is much broader. And I think that, at least for us, we've defined resilience often as kind of moving forward with the full weight of whatever experiences we've had in our life. So how do we move forward with it? For individuals, right, that looks like the ability to cope, integrate those negative things that have happened. But for communities, It's really, how do you do those things? How do you cope and integrate the negative things that have happened as you move forward, but also do it in relationship with each other, so that it doesn't lead to more alienation, but rather in some ways figuring out new bridges for building people closer to each other as a result of the event.
Thank you both. And Maggie, I'm just going to ask you a follow-up question around that, if you don't mind, of just, because mass violence is just so unique and different, I think, from other types of violence, in that because an incident occurs in a community, so individuals are impacted, and at the same time, the community at large is impacted, and even us as system providers that live in that community are impacted. Just kind of curious your thoughts or observations too about that intersection between individuals and providers in the community, and how in mass violence does that seem to complicate then that recovery, you think, or what that might look like?
It definitely complicates the recovery. I mean, I think that, we were a Jewish community that was attacked, and in the very Jewish sense that if there's someone who experienced loss, you know how to bring them food or show up for the Shiva. When 11 people die at the same time, and then a lot of people feel the impacts of that in the community, you can't show up in the same way you would for an individual who experienced trauma or loss. Instead, you sort of have to figure out, how do you attend to both your needs and also a neighbor or a friend who maybe has experienced the loss. And we talk here a lot about the challenges of those concentric circles, right? The closest circle being the people who didn't get to ever see their family members again. And then you think a little bit more about the people who survived or witnessed, and the first responders, and you sort of move out in those concentric circles. And if there was a perfect world for communities to respond to events like this, the way that we often talk about it is that you lean in to the closer circles to give support, and you lean out to the further circles to get support once you figure out where you are in relationship. But that sounds way easier than it is, because you don't know where you are. It gets confusing. You're lost when the trauma feels so close to home. And that it can shift. And so while that is wonderful, if we knew where we were on those concentric circles, it is a constant question of, am I helping this person because they are closer to the center, or am I looking for support? And if so, I don't want to go to someone who's closer to the center. And as a community, we can get through it if we learn how to know that. But the truth is we don't. And so it gets really messy and hard when unfortunately you lean in the wrong direction and maybe are not giving the right kind of community support as you could. I don't know if Alberto also experienced some of that.
We definitely did it, and that was one of the things where we can feel disoriented and not knowing exactly if what we're doing is the right thing. And yeah, I think that goes for any community, especially when we deal with a community that where a minority or a specific ethnic or racial group was attacked. I think that plays into it as well, and I perfectly see or can relate to that, since I've been working with the victims since the tragedy happened here in El Paso.
Yeah, can I elaborate? I mean, I think that part about the targeted violence and the number of people, where do you see yourself on those concentric circles when you identify with the people who were attacked?
Right, that adds an extra concentric circle in there.
Right.
Yeah, thank you. And how would you describe the purpose of resiliency centers? I gave sort of a broad overview of kind of what it is and the scope of services, but how, in your own words, describe kind of that purpose? I'll start.
Alberto used some really good words to describe it early on: creative, ingenuity. I think the purpose that I use sort of very simple words, but that our job is to create a new table that has the purpose of that table being this event. And I don't know exactly who needs to sit at that table or why, when you're creating the table. So a resiliency center is created to be literally a phone number to call when you have some specific question or need or offering. We get a lot of people who call the phone number to offer a piece of art or compassion for the victims or something like that. But you have to have the Resiliency Center set up to be visibly the hub for that event. And so that people know where to turn, because for us, the turning to the synagogue, which was the victimized organization, or for, Alberto turning to Walmart, which was the victimized organization, to be the place for that. One, it's a lot of burden on them while they're working on figuring their own trauma out. And two, they're not always the best party to know who needs to be at the table or be part of things. So the Resiliency Center is really important, and really important to be able to create that neutral space that people can identify with whatever that communal trauma was, because the difference between the communal trauma and an individual trauma is the visibility. So many people hear about it, so many people know about it, so many people have thoughts or questions or concerns or impact that we don't know who those people are. And so creating that Resiliency Center is crucial to be able to do that, and being very aware about the organization or the agency or the place where the shooting happened, as being a core stakeholder, but also themselves, it's a big burden for them to have to be the answer to that question. That's what I think of.
And I agree with Maggie. That's the main purpose of the Resiliency Center here in El Paso was to be a one-stop shop for all the resources within the community. Because there were so many, there was an outpour of community assistance that happened in the direct aftermath of the tragedy, but it was overwhelming when someone is just going through this very difficult time, knowing where to go to, and all these people wanting to help. It does become overwhelming. And in the case of El Paso, one of the things that we had to do, we were not aware that we were gonna have to do it, was to start assessing the needs of the community. We were one of the first communities that were low education, low technology, low income. A lot of elderly people were the ones who were present at the scene. And one of the first things that we did, like for that needs assessment, was when people started receiving their compensation from the National Compassion Fund, they started dispersing the funds, and a lot of people started losing government benefits because they had more than $2,000 in assets in their account. So that was like, okay, what do we need to do for them to get the money and not lose the benefits? So well, we are a one-stop shop, and it is a communal effort that when we bring in a lot of stakeholders, we need to reassess what our role is, like, constantly. And that is something that I believe is very, very important for any resiliency center.
Yeah, if you don't mind, you actually brought up a really good point about kind of the importance of when first, it sounds like both first establishing a resiliency center and then thereafter of really assessing the needs of the community, as opposed to making assumptions about what might the needs be, or just kind of doing a cookie cutter, establishing a center and kind of telling folks what they need. Just if you don't mind sharing a little bit about how each of you kind of went about that in your community. What did that needs assessment look like, and did it look different later on?
Yeah, I mean, I think I really resonate with what Alberto was just saying about kind of that agility or that need to constantly be ready to change and evolve. And so early on, I think the needs assessment helped a lot. We had it completed in relationship with the Office of Victims of Crime and their technical assistance arm. And so it was really helpful to have people who were wiser than we were. We were just the community. We didn't know what we were doing. Having that wisdom of people who knew more, and who could look at our community from really a 30,000 foot level. But what it actually looked like to be agile was to see that, to use it as a starting point, and then to remain really curious. So curious that sometimes it's hard to be more curious because, you have to listen to everybody. We really had to make sure we were taking all the input and then building some group of people that as decision makers, so that it wasn't on any one person's shoulders. Because I think that the needs assessment gives you a starting point, but then there's just a constant evolving need. You can't anticipate all of the problems that show up. And who are the people who help be your sort of moral compass? Can you have that be the families and survivors? That would be optimal. Some communities that's easier than others. In our community, that worked fairly well because we're a close-knit community. But if not them, then who else are close stakeholders that can help make each of those decisions in relationship with the Resiliency Center director, so that they're not doing it on their own? And I think the other really important part, so you start out with that needs assessment, you have to be deeply curious, and then the removal of ego, which is, I think, so hard and so important in the work of a resiliency center. If you're there to serve the benefit of an existing organization, there will be immediate backlash. And so, you know, as a director, the need to really try to check my own ego, but also as an organization, building identity without ego is a challenge, but really important if we wanted to make sure that the stakeholders were engaged in helping make the decisions. That was our finding, at least.
Alberto, do you have any other thoughts about that needs assessment?
I think keeping your ego in check is very important. And like the ego of the entire organization, because ultimately the community knows best about like what their needs are, and our role is mostly figure out how we're gonna like serve those needs and how we're gonna help them fulfill those needs that they have, understanding that we may come from a place of privilege, understanding that they come from different backgrounds. When it comes to the needs assessment, for the first 2 years, our funding allowed us to serve people from across the border. El Paso and Juarez, they are closely knit by national community. And understanding that some people in Juarez may not have the resources that people who were here, and understanding how to present those services to them and understand that those are a necessity, they're not a luxury. That comes with like understanding where you stand, what your role is, understanding that you are here, it's a place of service. It's and keeping your ego in check and the ego of like everyone involved in stakeholders is very important.
Can I highlight what Alberto just said about who you're funded to serve? In that needs assessment, that's crucial. The needs assessment outlines who you're funded to serve. And again, back to the point that both of our events were targeted violence events against groups of people, and that they were not outlined in the needs assessment as being who we could serve. And so the funding and the needs assessment, you know, where that's both limiting and opportunity building. There was a lot of opportunities we had through that needs assessment and funding for us, for example, being able to be a third-party payer for therapeutic services. And that was specific to some of the challenges for therapy in our community. But that there's challenges, but then there's also benefits, and how to weigh them as a resiliency center and continue to adapt, which I'm assuming once you couldn't serve people in Juarez, that things changed.
They did, and then we have the decision of how do we ensure continuity of care. We were lucky enough to work in collaboration with the Mexican consulate, who was able to put together a list of resources that people could access in Juarez, and that helped out a lot. So community partners, like they're a really big necessity for any successful resiliency center.
Yeah, well, it sounds like those partnerships, being flexible, knowing how to pivot based on kind of addressing kind of the challenges and the needs is really important too. Which is sometimes different from other types of organizations and how they're established and set up and how they provide services, right? In a very traditional approach, sometimes you've got to kind of take you know, more novel approaches to kind of problem solving. So what would you say are challenges for communities in healing after mass violence? I'll start this one with Maggie. Maggie, do you think are some challenges for communities?
I mean, I think Alberto actually covered some of them in the very beginning, and I was thinking that he actually talked a lot about some of the major challenges. I think, you know, that he sort of said this, but that this idea that each and every one of us had the feeling it couldn't happen here. And I'll say, unfortunately, in the Jewish community, we did have emergency planning that had already taken place. And even with that, there were a lot of things we couldn't have anticipated. So it's not that we really, you know, had a total naive thought that it could happen here, but it's hard to believe it could until it does. And that feeling of shock is a big challenge to the community. The feeling of shock makes it very confusing to be thrown into the public spotlight. Even if you had a plan for media communications, it's really hard to figure out how to navigate that as a community. I think that, you know, there's those concentric circles back again. One of our biggest challenges is around people feeling as though they're invisible. When you think about those circles and people saying, oh, or also the feeling that someone has more needs than I do, so I don't want to take up resources. I'm not going to come in for therapy because I'm sure there's someone who has a bigger need than I do. So, you know, we're constantly trying to figure out how to say that you matter, your voice matters, and there's some things that we only provide for the direct victims. So balancing those two things and sitting with that tension can be very difficult. I think that, you know, one of the things that we learned about too late was about the ways in which communities deal with trauma. And, you know, there's a predictable kind of graph that happens, and part of it has to do with there's a honeymoon, right? And almost everybody becomes stronger than, or powerful, or going to overcome something. That's our honeymoon phase. And then the only way to go from that honeymoon is that disillusionment. And as a community, that's just a really big challenge. You go from thinking we're all in this together to thinking maybe none of us are in this together. And when it's happening to you, you feel as though maybe this is a failure of us, instead of realizing it's actually a natural tendency, that the trauma brings us together, but that the truth is that can't stay like that forever. The previous disagreements or the stressors that resulted from the trauma do end up coming to the surface. And if communities could be better prepared for how to be ready and waiting, and potentially you know, have the relationships in place, broad reaching relationships to lean on for that period of time, disillusionment will come. I mean, I guess I can only speak for us, but I've talked to other people, and Alberto can say if it didn't happen there and everybody stayed in that honeymoon and agreement stage of life. But it just, that part's really painful and really hard. And it was a big challenge. And the hardest thing that I think is the Resiliency Center is how do we help make it so that wounds aren't created that can't get healed. You know, it's okay to have disagreements, but let's make sure they are ones that we can continue to work towards healing or unity, even if for a while we're not there. And so I would say those are some of the biggest challenges, but there's endless challenges. And I feel like Alberto said a few of the really important ones, but I can't emphasize enough the challenge of being part of a community going through something at the same time, and feeling those stressors, anniversary impact on a community that around that time of year, you start to feel tensions rise, you start to feel people just on edge, and everybody's doing it at the same time. Nobody means to take out their aggression on each other in the checkout line or on the road, but they're all in it at the same time. Alberto.
I agree. Disillusionment, it is something that happens. I always tell my team that we're only as successful as our last event or our last campaign, or because we need to keep things fresh, and it is a work intensive process that does happen in the long run. But I think for us, like most of the challenges, well, we got a hold of what we were doing. Came in the direct aftermath of August 3rd. And I think it was making the services not just available, but also accessible. The easiest part for us was to create community partnerships, bring in contractors to provide services, but still people did not think that those services were accessible to them. They saw it as a luxury, mainly because of the cultural background of our community, which is over 80% Hispanic, most of it Mexican Hispanic. So that was like the first challenge that we encountered. And you brought up something that about like someone needs this more than I do. Like self-disqualification, like that is something that we encounter over and over again, because that is embedded in at least Mexican culture. Is like the government provides services for those who need it most, without realizing that they truly need it. And it wasn't until I believe Uvalde happened, that was a watershed moment for us, when people realized that, you know what, like I think this affected me more than it should. Why would it be? And that's when we started seeing that change in culture, when people started reaching out to receive services. And we did consider it as a re-traumatization event. It is really unfortunate, but that was what it took for people to reach out and ask for help. So that was one of the biggest challenges. And on top of that, we lived right next to what used to be the most dangerous city in the world. So the cumulative effect of trauma can be seen across the board on both sides of the border. So that's something that we have had to start dealing with and like addressing in like the last couple of years. So that is another challenge that we faced.
I think Alberto, the ripple effects piece that you all, you Alyssa and people from OVC taught us about, but you don't know what the ripple effect will be. Some of them you do, maybe a trial, or for us, our building rebuilding. We know that will have community impact, but then, you know, another shooting or another event that feels too close to home. It's sort of, you're always in ready for it and never know exactly when it's going to happen. And that is a challenge always.
Mm-hmm. And Alberto, you brought up too, I think it sounds like the accessibility is a challenge in tailoring it, you know, for the cultural community where you're responding. But I do think that is true for any community impacted by mass violence, is really tending to what are the accessibility issues that might exist with perhaps other marginalized communities that exist in their you know, in their environment. What do people's relationship with systems have looked like before, context before, and so all those things I think impact accessibility and people's willingness to receive support, a knowledge of what the support is in the community, understanding of what a resiliency center may be able to offer. So I think you raised kind of a broader issue too, in different ways. What are some lessons learned about effective strategies? So we just talked about challenges. What, from your perspective, are some lessons learned about effective strategies for long-term recovery and resilience in communities? And I'll start with Alberto this time. That's okay.
I think something important, well, it is important to have like a streamlined system, like for responding and addressing mass casualty events. People don't like being a number. They don't like being part of a statistic. So if we try to reach people by letting them know, like statistics say this, like 55% people who went through this have said that they don't want to become part of this statistic. They don't want to be a number. So when it comes to campaigning and like getting the message out there, it took us about like a year to truly create like and cement our presence in the community. And after that, that's when we learned if we're gonna go anywhere with this project and if we're going to serve the community, we need to come up with a model that addresses the individuality of everyone's healing journey. And because of my background, I had experience with health promoters or promotoras de salud, which is it's a model that is based on talks or little like dialogues that you have with people, and that helped us reach the most people. Like we will have a little conversation. It could be at a community center, at a library, sometimes even at the Mexican consulate. We go there sometimes. And we have to present it in a way that it's relatable, because people will not respond to hard data. They will respond to life experiences. And that's one of the things that we learned and that have helped us be a successful resiliency center. That's one of the biggest takeaways. Like, make sure that you have a streamlined process, which is the resiliency navigation process, but make sure that each person who comes in the door feels unique, and their uniqueness and their special needs, all the needs they have are acknowledged.
Yeah,
Thank you.
I would add to that just one of the principles that someone taught us early on, which is that there's no wrong door. And that principle we lean on a lot, which is both a reminder that people don't have to come to us for their healing. If they already have a door that is one that's super effective, that we want to encourage it. We want to make sure we keep that up. So that might be, helping them get to a therapist that they like, not encouraging them to come to the therapist that we have. Or it may look like, working with our partners to make sure more resources are available at other agencies where they may feel more comfortable, and creating a new door where other people can walk through who haven't found anything that's helpful or healing yet. So that's sort of that was a really helpful thing that someone taught us early on. I think that our other sort of core elements of success have been to find champions. So someone will come and say, I really want equine therapy, and putting it on them to say, okay, can you find us the place? And then I'll work with the provider to see if that works. Or, we want to start a sewing circle. Okay, how many people do you have? We want to start a grief group for, people who have lost their children. And the idea that create the champions, instead of just saying yes to everything or no to everything, just being open to finding champions and finding things that maybe I wouldn't have thought of. And a lot of those have been very successful.
Wonderful. Well, thank you both so much. I know we had a brief time together, but I think we covered a lot of good information. Also just want to highlight to all of our attendees that the National Mass Violence Center actually hosts a forum for Resiliency Center directors. We meet monthly where we all come, Maggie, Alberto, and that's 24 other resiliency directors come together on a monthly basis to share these lessons learned, talk through some of these principles. So know that if unfortunately an event occurs in your community, that the Mass Violence Center is here for consultation and support, but also we have wonderful connections with our network of the resiliency centers across the country that we can connect you to continue to support your community. So thank you, Alberto. Thank you, Maggie, for this conversation. And Anne, I'm going to hand it off to you.
And thank you, Alyssa, and such an amazing panel. And thank you for mentioning the Resiliency Center Directors Forum, because that is a way to keep all the communities connected. And we now at the center sponsor forums for our Resiliency Center administrators, clinicians, navigators, and strategic communications. And so if you all love this panel, just know that we stay connected on a regular basis with the different folks who work at the resiliency centers across the country. So wonderful panel. And now we are ready for our final brief break of the day before the last session of our virtual summit.
Hello again. Our final session is resources available from the National Mass Violence Center and the National Center for Victims of Crime. I know today has been resource rich from all of our presenters, but in this closing session, we'd like to highlight resources from the National Mass Violence Center and the National Center for Victims of Crime, and give a shout out to our 19 incredible national partners. Please remember that following today's summit, you'll receive a link to our summit resource guide that lists all of the information we've been discussing now and more. In addition to leaving you with a treasure trove of resources for mass violence, preparedness, response, recovery, and resilience, we also want to emphasize your important role in these efforts. So now, to learn a bit more about the center's resources, it's my pleasure to introduce Aurelia Sands-Bell, who coordinates the center's Survivors and Providers Steering Committee. Aurelia?
Thank you so much, Kevin. And let me begin by saying that all of the National Mass Violence Center's resources that I'll be discussing are available on our website at nmvvrc.org. Our center has over 50 tip sheets, all about aspects of mass violence, readiness, response, recovery, and resiliency. Many of our tip sheets have been developed as a result from requests directly from the field. So please let us know of any topics you'd like to see in our center and have those issues addressed. When a mass violence crime occurs, we create a resource guide that is specific to the impacted community and where it occurred. It could be in a school, a faith community, a public arena, and whether it's motivated by hate or identity. It features links to state-specific programs like crime victim compensation and tip sheets for a collaborative response and recovery. Each resource guide is provided to the leaders of the community and state and is widely disseminated via social media platforms of our center and through our partners. With support from our many partners and allies, we have created best practices guides for helping mass violence survivors through criminal justice proceedings, such as our court guide, and for the creation and sustainability of resiliency centers. Several other best practices guides are in the works with our other national partners, and those will be coming out over the next 3 years. Our community and victim surveys offer an evidence-based look at the mental health impact of mass violence incidents on survivors and community members, including depression and post-traumatic stress disorder, and the importance of mitigating factors such as social support. 6 forums created for resiliency centers and schools to discuss challenges and solutions. We have just hosted our 10th virtual quarterly National Town Hall in a series where we delve into timely topics related to mass violence victims and community needs. And of course, mass violence preparedness, response, recovery, and resiliency. Our Transcend NMVC free mobile app provides self-help tips to survivors and others affected by mass violence. Transcend MMVC is available on the Apple and Google Play online stores. Our monthly mass violence podcast, affectionately known as our MVP, features great interviews with mass violence experts. And our virtual resilience center that you learned about earlier this morning offers important recovery and resiliency tips for mass violence survivors and others affected by mass violence incidents, and an online space for communities to build their own web pages prior to creating their physical resiliency centers. Woo, Kevin promised a treasure trove of NMVC resources, and he wasn't kidding. Finally, the National Mass Violence Center is very active on social media, Instagram, Facebook, X, and Threads. Please follow us on social media. It's important. It's an important element of our national outreach with information and resources. And now to Anne, who will highlight our center's 19 partners.
Thank you, Aurelia. And yes, it's about time for a shout out to our 19 national partners that y'all have heard so much about today. I love this slide. Our partners represent the partners that are also needed by you at the state, tribal, and local levels to prepare for and respond to mass violence incidents. And bear with me, I'm going to read them because we are so proud to have them on our team. American Hospital Association, the Association of Prosecuting Attorneys, Cleary Center, the CNA Corporation, Given Hour, International Association of Chiefs of Police, International Association of Emergency Managers, the National Association of Crime Victim Compensation Boards, National Association of School Psychologists, you're going to hear from the NCVC in a minute, the National Child Traumatic Stress Network, the National Crime Victim Law Institute, National Fallen Firefighters Foundation, National Governors Association, National Organization for Victim Advocacy, Police Executive Research Forum, Safe and Sound Schools, United Solutions Tribal Community Development Group, and the United States Conference of Mayors. I feel like that was an NPR commercial, but it is our list of amazing partners. We are so grateful to all of them. And now I'm grateful also to let you listen again to Renee Williams, Director of the National Center for Victims of Crime, about some of their resources. Renee?
Thank you for that, Anne. So NCVC has a wealth of resources available to victims of mass violence incidents, but there are two that I specifically wanted to highlight for you today. And the first is our National Compassion Fund. And you can find that either by going to our site at victimsofcrime.org or to the nationalcompassionfund.org. Next slide, please. The National Compassion Fund was founded by victims of mass violence incidents who were really bothered by the way donations that were meant for them were distributed throughout the community. So we developed a centralized, trusted, transparent way for the public to donate funds, and those funds go directly to victims and survivors of mass violence incidents. And we've been in operation since 2014. So far we've distributed over $105 million to mass violence victims. Next slide, please. The way we do this is we ask for direct contact in a community where a mass violence incident occurred. We will never come into a community and kind of force our will onto the community. We ask to be invited in, and then we obtain an engagement fee, usually $50,000 to $75,000, but that covers all of our administrative costs, from the staff time to the travel time. And then we form a steering committee. While we're collecting funds, we put something up on GoFundMe and a few other places, start collecting funds, and then we form a steering committee that's composed of members of the community, including faith leaders, including individuals that were involved in the shooting, and survivors of past mass violence incidents. And that's how we decide how to distribute those funds. Usually there are tiers that are distributed, but it is all done 100% to victims and 100% fairly. Next slide. The other way NCVC helps victims of mass violence incidents is through our Victim Connect Resource Center, which is available at victimconnect.org, or call or text us at 1-855-4VICTIM. If you go on victimconnect.org, we have a live resource map where you can drill down to somebody who can help you in your community. We also prepare our victim assistance specialists every time a mass violence incident happens to help victims in the community where it happened. So again, you can go on victimconnect.org or call us at 1-855-4VICTIM. We will be available 24/7 starting in August. And now I'm turning it back over to Dr. Dean.
Well, thank you very much, Renee. Thank you also, Aurelia, Anne, and Kevin. And special thanks to everyone who joined our summit today. Organizing this on-site and virtual summit required a Herculean effort by the staff of the National Mass Violence Center, the National Center for Victims of Crime, and by the Office for Victims of Crime. Wherever you are across our nation and around the world, please join me in thanking all of them for all of their hard work. Over the past 7 years, the National Mass Violence Center has learned 5 fundamental things. First, no community in our nation is safe from mass violence and its devastating consequences. If your community hasn't experienced mass violence yet, it may in the future. Second, when mass violence happens, you are no longer alone because your community joins an amazing, larger community in the United States and around the world that is committed to mass violence preparation, response, recovery, and resilience. Third, in the wake of mass violence, there is hope and there is healing. Fourth, communities that have gone through mass violence often offer their support and guidance to others impacted in communities to build resilience. Learning from them can help you avoid reinventing the wheel. More importantly, it can also keep you from reinventing the flat tire. Fifth, there are wonderful federal, national, tribal, state, and local organizations and agencies with whom you could and should partner with for mass violence preparation, response, recovery, and resilience. Finally, here's an interesting factoid. You cannot spell the word community without including the word unity. And there is unity in the worldwide community of our important work. Each of you has an important role in this work. I hope today's summit has strengthened your sense of unity as well as your capacity for and commitment to this critical work. Thank you all so much, and back to you, Anne.
Thank you so much, Dr. Dean. And Dr. Kevin and I are just very, very pleased to be able to close out today's summit. We want to say thanks to all of our virtual summiteers for spending a very long but also really important day with us. All summit registrants will receive a follow-on email from the National Mass Violence Center with a link to all of the resources that we've talked about today. We encourage you to join our NMVC mailing list so that you can get our newsletter and just other announcements about the great resources that we will be developing over the next few years. And in a quick flash, after this slide disappears and our virtual summit officially concludes, we ask that you wait a moment. A very brief virtual summit evaluation survey will magically appear that will take you less than 5 minutes to complete. Your summit evaluation and input will help us plan for and improve our future training programs. So we are just so grateful to everyone for joining us today. And Kevin, a final thought to you.
Thank you all on behalf of the whole team for joining us. I hope you do stay involved and work supporting your community against mass violence, and send us your questions. Thanks again.